Test. Attention please. Ladies and gentlemen, please be seated in the room of the conference. The event is about to begin.
Mohon perhatian, hadirin diharapkan untuk masuk ke dalam ruang auditorium karena acara akan segera dimulai.
Assalamualaikum warahmatullahi wabarakatuh. Good morning. Best wishes to all of us.
We would like to express the warmest welcome to our honorable guest today.
To Profesor Dr. Ernawati MS APT as a Vice Rector for Research, Community Service and Cooperation of Universitas Nasional.
Profesor Dr. Retno Widowati, Master of Science as Dean of the Faculty of Health Science, Universitas Nasional.
Director of Social Health Insurance Administration Bali Indonesia, Profesor Dr. Ali Gufron Mukti, Master of Science PhD, warm welcome.
Profesor Dr. Farida Muhammad Said, RN, Master of Science from Lincoln University College, Malaysia.
Maria Elizabeth Coronel Bawah, RN, RM, MSN, DNE, DNS from St. Paul University, Philippines. Warm welcome.
Vildan Chakar, Master of Science, RN, PhD from Istanbul Medipol University, Turkey.
Associate Professor Dr. Sopan Chunwan from Prince of Songkla University, Thailand.
We respect all faculty leaders, lecturers, students, and all of our guests that joining our event here in the auditorium or through the virtual channel on YouTube streaming. Let us introduce ourselves first. I'm Siti Zulaika and
I'm Sadicia Manifatiha from the Faculty of Health Sciences. We are very honored to be the Master of Ceremony of today's event.
welcome to the Second International Conference on Health Sciences 2024.
With the theme, Wound Care Management and Complementary Therapies in the Holistic Health across the Asia region. In collaboration with Indonesia Social Security on Health, Lincoln University, Malaysia, St. Paul University College, Philippines, Istanbul Medipol University, Turkey, and Prince of Songkla University, Thailand. This hybrid conference is also part of the series in celebration of the 75th anniversary of Universitas Nasional.
Selamat pagi dan selamat datang di International Conference on Health Science yang kedua di tahun 2024. Sungguh sebuah kehormatan bagi kita semua untuk berkumpul dalam momen penting ini. Sebelum memulai acara, izinkan kami memulai acara dengan sebuah pantun untuk menyemarakan suasana. Ke kampus pagi membawa semangat. Universitas Nasional tempat kita berkumpul.
Dalam konferensi yang penuh manfaat, ilmu dibagi, wawasan terkumpul.
Before we begin, for the smooth running of today's event, we invite Bapak Dr. Nurse Rizky Hidayat, Master of Nursing, to lead us in prayer.
Para hadirin sekalian, sebelum memulai acara, marilah kita berdoa bersama demi kelancaran acara pada hari ini. Kami mengundang Bapak Dr. Nurse Rizky Hidayat untuk memimpin doa.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. For the blessing of the God of the Second International Conference on Health Sciences Seminar, let us all recite the prayer. I ask permission to recite the prayer in an Islamic way. For those of all the beliefs, please adjust. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين حمدا شاكرين حمدا يوافي نعمه ويكافئ مزيدا يا ربنا لك الحمد كما ينبغي لجلال وجهك الكريم وعظيم سلطانك اللهم صل على سيدنا محمد ربنا ظلمنا أنفسنا وإن لم تغفر لنا وترحمنا لنكونن من الخاسرين ربنا ولوالدي وارحمهما كما ربياني صغيرا اللهم إنا نسألك سلامة في الدين وعافية في الجسد وزيادة في العلم وبركة في الرزق وتوبة قبل الموت ورحمة عند الموت ومغفرة بعد الموت اللهم هون علينا في سقرات الموت والنجاة من النار والعفو عند الحساب ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار والحمد لله رب العالمين. Assalamualaikum warahmatullahi wabarakatuh.
Thank you to Bapak Dr. Nurse Rizky Hidayat, Master of Nursing, for graciously leading the prayer for our event. Before entering the series of events, let us sing the national anthem, Indonesia Raya, followed by Universitas Nasional Mars. Ladies and gentlemen, please stand up.
Hadirin dipersilahkan untuk berdiri.
Indonesia tanah airku, tanah tumpah darahku. Di sanalah aku berdiri, jadi pandu hidupku. Indonesia kebangsaanku, bangsa dan tanah airku. Marilah kita bersatu, Indonesia bersatu. Hiduplah tanahku, hiduplah negeriku, bangsaku, rakyatku semuanya. Bangunlah jiwanya, bangunlah badannya untuk Indonesia Raya. Indonesia Raya merdeka, merdeka, tanahku, negeriku yang ku cinta. Indonesia Raya merdeka, merdeka, hiduplah Indonesia Raya. Indonesia Raya merdeka, merdeka, tanahku, negeriku yang ku cinta. Indonesia Raya merdeka, merdeka, hiduplah Indonesia Raya. Perguruan kami, Universitas Nasional yang kami cinta. Lahir zaman revolusi, penuh halangan serta rintangan. Walau betapa beratnya, sulit pahit diderita. Banyak korban denda dan rasa, kami pikul bersama. Ketika Dewan Guru, Dewan Gurakan Mahasiswa, mari maju terus maju, pantang lagi bimbang dan ragu. Lanjutlah umurnya, perjuangan yang kami cinta. Tempat kami memetik sari, ilmu dan anak budi. Merdeka Sentosa Jaya, aman damai seluruh dunia. Itulah cita-cita putra putri Indonesia.
Ladies and gentlemen, please be seated again.
Hadirin dipersilahkan untuk duduk kembali. Ladies and gentlemen, let us watch the profile video of the Faculty of Health Sciences.
The Faculty of Health Sciences at Universitas Nasional was founded on January 5, 2007. In response to the growing demand for skilled healthcare professionals both nationally and globally. At that time, Indonesia's health sector faces significant challenges in ensuring an adequate supply of professionals with not only practical expertise, but also the ability to navigate the evolving landscape of science and technology within healthcare. The Faculty of Health Sciences of Universitas Nasional is dedicated to advancing science and technology. with the aspiration of achieving world-class university status by 2025. The establishment of the Faculty of Health Sciences at Universitas Nasional was made possible by the efforts of various stakeholders. Today, under the leadership of Professor Dr. Retno Widowati MSc and Dr. Rukmaini SSTM the Faculty of Health Sciences at Universitas Nasional continues its progress towards achieving a global vision.
The Faculty of Health Sciences at Universitas Nasional is dedicated to becoming a leading private health education institution with excellence in development of science and research in holistic health. We are also actively engaged in evidence-based research and committed to community service initiatives. We consistently implement community service through promotional and preventive strategies to support health at every life stage. Guided by our vision of achieving both national and global excellence, the Faculty of Health Sciences at Universitas Nasional continues to innovate in education and research, remaining committed to making meaningful contribution to society and the global health community. We offer programs in nursing, midwifery, nurse professional education, midwife professional education, and a master in midwifery. All education process adhere to the national curriculum and the professional standard.
The Faculty of Health Sciences at Universitas Nasional is equipped with advanced facilities, including specialized labs such as the wound care laboratory and baby spa. With cutting-edge digital learning technology and a comprehensive library, we provide an immersive learning experience that prepares students to compete on a global scale. Since its inception, the Faculty of Health Sciences at Universitas Nasional has established partnerships with a range of hospitals and healthcare institutions, offering students valuable opportunities to gain practical experience and enhance their competencies. The Faculty of Health Sciences at Universitas Nasional has attained accreditations from Lampedekes for all study programs. Our faculty's lecturers and students have also achieved significant accomplishments at both national and international levels, contributing meaningfully to the global health community. We believe that the Faculty of Health Sciences at Universitas Nasional can cultivate a new generation of health professionals poised to drive change in the future. Join us in building a healthier, better tomorrow.
Entering the first session of today's event is an event report. We invite Ibu Nurse Nazia, Master of Nursing, as Chairperson of the Second International Conference on Health Science to deliver the event report.
Memasuki acara pertama, yaitu laporan kegiatan yang akan disampaikan oleh Ibu Nurse Nazia, Magister of Nursing, selaku Ketua Pelaksana kegiatan Second International Conference on Health Sciences. Kepada Ibu Nurse Nazia, kami persilahkan.
Good morning, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi to all of us. First, I'd like to thank Allah Subhanahu wa Ta'ala for giving us His blessing so that we could hold this activity. Because of His mercy, we are sitting in this opening event in good health. the Excellencies Vice Director for Research Community Surveys and Cooperation, Professor Dr. Ernawati Sinaga, MS, APT, the Honorable Dean of Faculty of Health Sciences and speaker our event this morning, Professor Dr. Retno Widiawati, MSE, the Honorable keynote speaker our event this morning, Prof. Dr. Ali Gufran Mukti, MSc, PhD, as Director of Social Security Administrator for Whole Republic of Indonesia, the Honorable Speaker from Department of Nursing Program, Lincoln University College, Malaysia, have attended the Cyber Room Universitas Nasional, Professor Dr. Farida Muhammad Said, RN, MSc, the Honorable Speaker from Department of Nursing, Medipol, University Istanbul, Turkey, Fildan Chakar, MSc, RN, PhD, the Honorable Speaker from San Paul University, Philippines, M.A. Elizabeth Cornell Bewa, RN, MRN, MSN, DNA, DNS, the Honorable Speaker from Prince of Songkla University, Thailand, Associate Prof. Dr. Sopen Chinuan. I'm on behalf of community, hope this event can go well and smoothly. Without your support, we can do so. We are humbly asking for your support so that this event can run as well as possible. I would like to thank all the sponsors our event, the Second International Conference Health on Sciences, and the honorable guests, ladies and gentlemen. This activity aims to establish cooperation between researchers of the same scientific, especially those from abroad. The participation of the researchers in international conference also open up opportunities for the scientific publication in international journal that have a good reputation, of important stage in the publication process in the dissemination of the research result through the conference at the international level. Through the International Conference on Health Sciences, lecturers at the Faculty of Health Sciences in the particular and other lecturers at the Universitas Nasional Jakarta in general can publish the result of their research in the International Scientific Forum. This event is the series of 75th anniversary of Universitas Nasional in accordance with the vision and mission of the Faculty of Health Sciences of the Universitas Nasional. Our vision in the faculty is to become a private faculty of health sciences in Indonesia that is professional and superior in the development of health sciences and research, as well as nationally competitive and globally insightful in 2026. So theme of our activity this morning is wound care management and complementary therapies is holistic health across the Asia region. Allow me, as the chairman of the submit a report on the participation of the participant today in the Second International Conference on Health Sciences amounted to 315, with the implementation of the activity carried out in the hybrid with the participants from Indonesia, Malaysia, Thailand, and the Philippines. The Second International Conference on Health Sciences had a series oral presentation and poster presentation attended by participants from Indonesia, Malaysia, Thailand, and Philippines. That's all for me, as well as a prayer so that it can run smoothly, and of course, this event can provide benefits and additional knowledge for all of us. Happy conference, and thank you very much. Enjoy your time. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you to Ibu Nurse Nazia, Master of Nursing, for the outstanding event report.
The next agenda is a speech from Ibu Profesor Dr. Retno Widowati, Master of Science, as a Dean of the Faculty of Health Sciences, Universitas Nasional.
Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillah wa syukurillah wa la haula wa la quwata illa billah. Allahumma sholli ala Sayyidina Muhammad wa ala alihi wa sahbihi asma'in. Good morning everyone, good morning ladies and gentlemen. Distinguished Vice Rector for Research, Community Service and Cooperation of Universitas Nasional, Profesor Dr. Ernawati Sinaga, APT, MSc, our esteemed keynote speakers, President Director of the Social Health Insurance Administration Body, Professor Dr. Ali Gufron Mukti, MSc, PhD, and then Honorable invited speaker from Malaysia, Professor Dr. Farida Muhammad Said from Lincoln University College attending on-site, thank you. And another invited speakers joining us online, Elizabeth Coronel Bawa, RN, RM, MSN, DSN, DSS from the St. Paul University, Philippines. And then Associate Professor Dr. Sofen Hunwan from Prince Sokla University, Thailand. And then Dr. Fildan Chakran, RN, MSc from Medipol University, Istanbul, Turkey. Distinguished participant, oral and poster presenter, both on-site and online. Welcome to the second International Conference of Health Sciences, hosted today, Saturday, November 2, 2044 at UNAS Auditorium, campus of Universitas Nasional. It is a honor and pleasure for us, the Faculty of Health Sciences at Universitas Nasional, to hold this international conference for the second time following a long hiatus. This event possible due to the dedicated support of the Rector and Vice Rector of Universitas Nasional, and it is a meaningful part of our celebration for the 75th anniversary of Universitas Nasional. Ladies and gentlemen, the importance of health is unalienable, but its scope for discussion is vast. The theme for this conference, Wound Care Management and Complementary Therapies in Holistic Health across the ASEAN region, reflects the scientific focus of our nursing department on wound care and the midwifery department on complementary therapies. We unite these two areas under the broader concept of holistic health, alignment with the scientific vision of Faculty of Health Sciences at Universitas Nasional. Wound care and the complementary therapies are integral to our research initiative and community service led by both our faculty lecturers and students. The theme, regional focus on Asia, underscores ongoing collaboration with university and academics within the ASEAN continent. We hope to expand this cooperation to other continents in the future, inshallah. Ladies and gentlemen, we hope that all conference participants and presenters will engage fully, gaining valuable international experience and insight from the second International Conference on Health Sciences. Allow me to extend my deepest gratitude and appreciation to all stakeholders at Universitas Nasional, Rector and Vice Rector, the UNAS Marketing and Public Relations team, and the entire committee coordinated by Nurse Naziah MKet for their exceptional dedication. Our sincere thanks also to the Social Health Insurance Administration Body, along with our industry partners who have greatly supported and enriched this conference. May Allah bless us all. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you to Professor Dr. Retno Widowati, Master of Science, for the inspiring word and insight shared with us today. Now, let's energize the atmosphere with a vibrant welcome dance. Please enjoy this performance as we celebrate the spirit of togetherness and the start of our event.
The Wonderland dance represents the beauty of Indonesia's diverse nature and culture. This dance is a fusion of various traditional dance from several regions, including Java, Papua, Riau, Kalimantan, and Aceh.
Indonesia is the most beautiful land in the universe. The land where we were born. The nation where we grew up. So many colors that live together in peace. With a million timeless treasures. With an abundance of natural wealth. Indonesia is not just wonderful. Indonesia is a wonderland.
Kota baru ujungnya Banggai jauh, Banggai jauh, Bangana di Salangkara, Bangana di Salangkara. Katamu lawanlah Adinda, Adinda iman tidak darah, Semalaya iman tidak darah, Semalaya. Sayang, sayang, sifat tokaan, matego, tego, gorokan. Sayang, 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 sifat tokaan, matego, tego, gorokan. Sayang, sajojo, sajojo. Yumadam ko bisa papare sa muna 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 keke, sa muna 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 keke. Soleram, 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 anak yang manis, janganlah dicium, sayang kalau dicium merah pipinya. Kampungan jauh di Batu, Kunwangsan sebaku liliang, takkan aja kawan-kawan nalamu, sangke basurian surian.
Let's give a big round of applause to our dancing team for amazing performance.
Before continuing the event, let's watch the video of Social Health Insurance Administration Body Indonesia.
Dibikin mudah adalah hal kecil yang bisa berarti besar bagi orang lain.
Silakan.
Makasih Mbak.
Sama-sama. Tunggu.
Walau hanya tindakan kecil,
Makasih, Pak.
menunjukkan arah,
Tukang tanya, jalan ke rumah sakit Islam sebelah mana ya?
Oh, rumah sakit Islam. Lurus, belok kanan, nanti lurus dikit.
atau berbagi di saat sulit.
Permisi, Pak. Ini buat Bapak buat buka ya.
Banyak hal yang kita dapat lakukan
Boleh
untuk
saya bantu?
memudahkan urusan orang lain. Begitupun layanan BPJS Kesehatan. Beneran dibikin mudah, tambah berserah baru, bisa sambil tiduran. Mau bayar iuran, auto debetin aja. Konsultasi dokter bisa lewat aplikasi. Daftar ke fasilitas kesehatan, pakai antrian online, tinggal datang sesuai waktu layanan. Pas nggak bawa kartu, pakai KTP udah bisa loh. Beneran dibikin mudah. Iklan layanan masyarakat ini dipersembahkan oleh BPJS Kesehatan. Dibikin mudah.
The next agenda is a speech from our keynote speaker, Bapak Profesor Dr. Ali Gufron Mukti, Master of Science, PhD.
Kepada Bapak Profesor Dr. Ali Gufron Mukti, Master of Science, PhD, kami persilahkan.
Assalamualaikum warahmatullahi wabarakatuh. First of all, I would like to thank for the invitation and also Honorable Vice Rector for Research, Community Services and Collaboration, Professor Dr. Enawati Sinaga, Apotheker, also the Dean Faculty of Health Sciences, Professor Dr. Ratna Widawati, MSc, as well as all the Vice Deans and our resource person from Lincoln University, Malaysia, Profesor Dr. Farida Muhammad Said. Terima kasih. Mediopol University Turki, Fildan Cakar, MSc RN PhD, Tasakur Ederim, San Paul University, Filipina, MA Elizabeth Coronel, Maraming Salamat Po, and also Prince of Songkla University, Thailand, Associate Professor Dr. Sofen Chunwan, Korkomakap. Ladies and gentlemen, here I am accompanied by Ibu Kiki Lestari, and of course also Pak Heru. Ladies and gentlemen, first of all, I would like to explain a little bit about BPJS Kesehatan before we are talking about wound care management and complementary therapies in the Asia region. Next slide, please. BPJS, or we call it here National Health Insurance or CKN. Next slide. Next slide, please. So, it was actually in the year 1988, Professor Siwabesi, G.A. Siwabesi, who actually trying to establish, we call it BPDPK that time. Professor G.A. Siwabesi was also the Minister of Health that time and also working in the BRIN. So here, now I'm not Professor G.A. Siwabesi, there is no relationship, but I'm as Professor Aki Mukti. So sometimes, you know, from the 1968, then we developed in the year 2014, the PT Askas changed to be BPJS Kesehatan. Next slide, please.
So ladies and gentlemen, many people do not know actually BPJS Kesehatan is public legal entity in the right side, which is not as the business-oriented entity. And actually, the funding is different with Malaysia because Malaysia is mostly a tax-based system, national budget, but in Indonesia, there is also national budget, but for the poor, it is the, in the article in our constitution, that for the poor is paid by the government. But in general, it is based on the contribution. So everyone has to pay something like that, except for the poor. So those who are, working in the government, so government pay as the employer 4%, the employee 1%, both in public or in the private institution. And then again, for those who are working in informal sector, they can choose $3, $6, and $10 monthly. Next slide, please. So, ladies and gentlemen, that is actually, the tasks and duties of BPJS Kesehatan. Many people do not know that actually on the supply side is not responsibility of BPJS Kesehatan, but BPJS Kesehatan is in the demand side. As the nurses, actually the deployment and distribution of nurses is actually again not responsibility of BPJS Kesehatan, but responsibility of Ministry of Health as well as local government. Ladies and gentlemen, next slide. About the universal coverage. What is the universal coverage? According to WHO, universal coverage is a situation where everyone, every time, can access of quality healthcare without financial hardship. So that is very important. In Malaysia, for example, because of tax base, so everyone can access to healthcare via public hospitals, just paying RM1. That is right, Prof. Farida. So, but in Indonesia, actually, we can also access freely, gratis, gratis itu bahasa Belanda, free of charge, to public and private hospital. And any cost, at any cost, actually BPJS who pay. So I'm with our colleague in BPJS who pay. So everyone, because at that time in Yogyakarta, the book entitled, "For the Poor, it is forbidden to fall sick." Now I changed the title that for the poor, it is forbidden to pay if they fall sick, if they are member actively to BPJS Kesehatan. And BPJS Kesehatan is very cheap because only paying 35,000 rupiah, meaning around $2 or $3 US dollar monthly. Ladies and gentlemen, when we look at the journal Lancet, in German, to achieve universal coverage, 85% need around 127 years. In Brussels, Belgium, need 118 years. Japan need 36 years. The fastest in the world is in South Korea, need 12 years. But Indonesia need only 10 years. Tepuk tangan untuk Indonesia yang hanya butuh 10 tahun. Bandingkan dengan Jerman 127 tahun. Ya, ini banyak yang tidak tahu. Ya. Nah, kalau mahasiswa UNAS, saya kira mulai tahu. Ya. Next slide, please. So now our member is 277 million, and all health facilities in Indonesia, almost all, already collaborated with BPJS Kesehatan. So BPJS Kesehatan is very, very powerful. Because you see here 23,000 clinic health facilities, puskesmas, primary health facilities in the Indonesia working together with BPJS Kesehatan. Previously, private hospital were lazy to collaborate with BPJS Kesehatan. Now they have to inline, dia harus antri kerjasama dengan BPJS Kesehatan. Tepuk tangan untuk BPJS Kesehatan yang luar biasa. Next slide. We see it here, how much money? So 912 trillion rupiah. There is no any ministries in Indonesia who manage money as much as BPJS Kesehatan. Sure. So therefore, now many people are interested to manage and to collaborate with BPJS Kesehatan. So here, for the catastrophic diseases, a year we spend 34 trillion rupiah. That is around at least more than 2 billion US dollar a year to spend for catastrophic diseases, including diabetes who has the wound, patient who has chronic wound, sometimes necrosis wound, so it is paid by BPJS Kesehatan. Ladies and gentlemen, next slide please. Next slide. So that time, every day, only 252,000 utilization, including wound diseases. But now, every day, total utilization per day is 1.6 million. In fact, now 1.7 million. And all this captured the information by BPJS Kesehatan. So those who has no problem, because usually who took PhD or master degree, the problem has no problems. The problem is no problems. So if you do not have problem, come to me, come to BPJS Kesehatan, I will give you problems. Because too many problems in BPJS Kesehatan. Sure. And now, every day, you can see it, 1.6 million utilization, and we capture all the transaction. So the biggest, when we are talking about big data, BPJS is the biggest data, and not only in Indonesia, maybe in many countries, not only ASEAN. ASEAN, you can mention which country who has data bigger than BPJS Kesehatan? No one. BPJS Kesehatan is huge. So if you would like to get PhD, we are welcome working together with Lincoln University, with UNAS, with many universities in the world to analyze our data. Previously we are closed, but now we open and transparent. That is really why, because I was previously the dean and rector or president of the University of Trisakti for almost 5 years. Also in the higher director higher education. Next slide, please. So, ladies and gentlemen, next slide. Yeah. So, wound care utilization in BPJS. Why BPJS is really can control the quality, but at the same time control cost? Because we implemented what we call it managed care. So people like in UK, in Australia, have to go to primary health care first. So cannot go to the specialist in hospitals. But the problem, Indonesian people do not believe in primary care, especially in puskesmas. It is the problem. But I think we should manage. So again, we have to go to primary health care. If it is necessary, then refer to the hospital. Next slide, please. So we are covering health promotion, prevention, curation, and also rehabilitation. That is what we covered already. Next slide, please. Ladies and gentlemen, when we are talking about wound utilization in the year 2023, so the wound patient is always increasing by year to year, by month to month. And always now, per month, can be more than 379,000 people are hospitalized, and sometimes, usually are hospitalized, or at least in the outpatient, and it was paid and managed, at least paid by BPJS Kesehatan. Next slide, please. What are the diagnoses related to wound? This is the diagnosis related to wound. Mostly a follow-up examination after other treatment for other condition. In this cases, 1.114676 million. And of course, follow-up examination after surgery, that is around 609,000. Attention to surgical dressing and sutures, 700,000, and so on and so forth. Next slide, please. So, ladies and gentlemen, for the complementary management, actually, for example, like how the honey, madu, can be used for treating the wound or any type, and how actually currently we use acupuncture, and it is still trying to be included in national formulary, so can be paid by BPJS Kesehatan. Actually, not only that, now many of my friends are developing stem cell to treat the wound infection. And those who usually, it is, necrotic wound, and sometimes need to be amputation, so now is no need, and can be cured within very short period of time. So, ladies and gentlemen, of course that many things now is covered by BPJS Kesehatan and usually used very highly. But the important thing for complementary management and also for wound treatment, whether it is paid by BPJS or not, and including in national formulary or not, depend on the result of health technology assessment. So health technology assessment, the criteria, next slide please, the guideline is like, next slide. Yeah, the guideline, the important thing here, first, we should assess topic selection, for example, like wound, using acupuncture, for example. But the problem, it is done by under Minister of Health. Sometimes Minister of Health has no money, no budget. So BPJS say, okay, we will give you money, and please do health technology assessment for acupuncture, and for that is complementary disease management, and also for wound infection, for example. We can give the money, but if Minister of Health has already budget, they can do it. And if it is proof, assessment, and proof that it is cost effective, then include it into national formulary. Now, next slide please. What are the role of BPJS Kesehatan? Next slide please. Yeah. Oh, not yet. Okay. So now, basically, that is the business process of BPJS Kesehatan. The important here in the business process of BPJS Kesehatan, within one slide, we will know exactly how BPJS Kesehatan is conducted and how it works. So basically, it's in the round, in the middle. So BPJS Kesehatan is doing revenue collection. Now your revenue collection can be 98% of the people paid to the BPJS Kesehatan. Number 2, risk pooling. Number 3, strategic processing. How we purchase health services strategically. So in the primary healthcare, we use what we call it performance-based capitation atau kapitasi berbasis kinerja. Saya tidak tahu para perawat, para ini sudah paham belum dengan kapitasi berbasis kinerja. Maybe next time I can explain. Ya. Saya bisa jelaskan what is performance-based capitation. So the way now, for example, if teleconsultation. Jadi sekarang tidak hanya orang sakit yang pakai BPJS Kesehatan. Orang sehat pun ya bisa pakai kesehatan. Contohnya umpamanya Bu Azizah ya, yang mungkin agak pusing-pusing. Kenapa? Karena sudah tanggal 2 kok gajinya belum turun umpamanya. Lalu bingung-bingung, nah karena pusingnya karena gajinya dari UNAS belum turun, ya, sudah tanggal 2, atau karena memang ada pusing ya. Nah itu bisa telekonsultasi gratis ya. So ya Bu Aziza, you can consult freely, free of charge. Now not only those who are really sick, but those who are, just to check. Not only that, like in Malaysia, and we discussed already, we are having what we call it screening. So why we use what we call it history of health screening. Jadi screening berbasis riwayat kesehatan. Answering 47 question using mobile JKN. Jadi mobile JKN is a multi-function application, multi-function apps. Jadi dari Anda jawab 47 pertanyaan, nanti di situ bisa diklasifikasikan ya. Apakah Anda ya itu punya kecenderungan sakit diabetes? Nanti ada wound-nya di situ atau tidak. Nah, lalu BPJS otomatis ya di mobile JKN itu menyarankan ya di mobile sini menyarankan otomatis. Banyak negara belum bisa nih, Indonesia sudah bisa nih. Menyarankan Anda ya Anda harus bisa ya, you have to suggested by the system that you have to check your glucose level if you are supported that you have high risk prone of diabetes mellitus, for example like that. Jadi tidak hanya itu ya, berbagai macam penyakit seperti hipertensi, stres ya, tinggal jawab. Dan saya yakin di sini banyak yang belum tahu, belum pakai. Siapa yang sudah pakai mobile JKN coba? Ada juga ya, banyak juga ya. 1, 2, waduh, ya kira-kira 1/4 ya. Luar biasa, tepuk tangan untuk teman-teman UNAS udah pakai mobile JKN ya. Because in Indonesia we already provide many things. Because BPJS is so advanced, but the problem is the community not yet literate with mobile JKN. But here in UNAS, many of you already downloaded mobile JKN. Sekali lagi tepuk tangan untuk UNAS yang luar biasa sudah melek literate terhadap mobile JKN. So again, now we have 950,000 payment channel ya. Saya nyebut 10 aja sulit ya. Ada OVO, GoPay, ada macam-macam 950.000. Kalau Filipina lewat udah ya. Bener ini. PhilHealth ya baru kemarin kami di Kuala Lumpur mau mengundang Indonesia dan mereka nggak percaya. Kok Indonesia bisa lebih maju dari Filipina gitu. Ini luar biasa ya. Tidak hanya itu ya, kita semua di all main activities supported by IT system. Nah tadi yang saya jelaskan sedikit saja, IT system ya. Tidak hanya itu ya, peserta dibagi 3, subsidized premium for the poor, all paid by the government. Yang punya gaji, wages, 1% employees, 4% employer. Those who are contributed for informal sector can be $3, $6, $10 US dollar. Next slide please. And wait a minute. You can be back. This is the most important of BPJS Kesehatan. First, single integrated scheme. And now not only 96%, ini masih lama terus Mbak Kiki. Tolong dicek selalu pakai ini yang 98% ya. Sekarang kita sudah bisa mencapai 98% penduduk Indonesia. Luar biasa nih. Dan tercepat di dunia ini untuk mencapai USC. That is really amazing. Not only those, when I came to BPJS Kesehatan, it was still deficit, ya, duitnya kurang, ya. Kalau orang Jawa bilang, we cannot do it without duit, ya. Kita nggak bisa kerja tanpa duit, gitu, without money, something like that, ya. Nah, sekarang dari defisit kita rubah jadi surplus, sampai bingung, banyak negara bingung, presiden juga bingung. Kok bisa-bisanya dari defisit jadi positif Pak? Kami diundang ya, kami diundang ke sana. Dan sekarang banyak dari berbagai negara pada datang belajar, ingin tahu gimana caranya. Dia nggak tahu, ini secret management ya, manajemen rahasia. Down payment ya, sekarang rumah sakit, klinik kami kasih uang di muka. Belum pernah terjadi dalam sejarah BPJS seperti itu ya, not yet. So now because we pay in advance to the hospital, now hospital are in line, would like all working together, public and private. So in Malaysia usually only public hospital, ya, rumah sakit kerajaan yang boleh Rp1, tapi di swasta it's different. But now they are trying public-private partnership. Ya. Oke, kita kembali lagi. Tarif kita naikkan bersama Kementerian Kesehatan. Kapitasi belum pernah naik, baru kali ini kita naikkan. Wah, ini tepuk tangan lagi ini. Terlalu banyak tepuk tangan ya. Lalu satisfaction levelnya meningkat tajam sekali. Dan kebanyakan saya bilang jangan terlalu puas ya. Masa puas 90%. Out of pocket ya 49% turun menjadi 25%. Nanti bisa dibandingkan di berbagai negara di ASEAN. Indonesia luar biasa. Nah, seorang WHO ya di Washington dia cerita bahwa USA tidak berkorelasi dengan turunnya out of pocket menurut penelitian mereka, menurut pengalaman mereka. Lalu saya bilang, mohon maaf, Anda yang sampaikan itu enggak benar karena di Indonesia USA bisa menurunkan sampai 50% out of pocket. Ya. Berikutnya, ya. Jadi kita ini sekarang ini kerjasama dengan 4 komponen, ya. Komponen interconnected with digital transformation, namely healthcare provider dari seluruh fasilitas pelayanan kesehatan di Indonesia kerjasama dengan BPJS dan interconnected. We use what we call it health facility information system, and we use PCare. Ya, sudah pernah ada yang dengar PCare? Pernah ya? Mantap ini, tepuk tangan juga nih. Waduh, PCare ya. Iya, seluruh fasilitas pelayanan kesehatan tingkat pertama pasti menerapkan PCare. Siapa yang kembangkan? BPJS Kesehatan. Itu. Tidak hanya itu. Ini that is real ya. That is healthcare provider. Then interconnected with stakeholders, especially ministry in central level and also local government. Jadi ini semua interconnected. And we give what we call it dashboard. Ya. Dashboard itu bisa tahu ya penyakit paling banyak apa, berapa orang yang sudah make, yang bayar dan lain sebagainya. Kemudian dengan bank and finance. So we interconnected. Now they can call, can pay. Not only those ya, bisa automatic debit. Automatic debit, yang penting rekeningnya ada isinya, ada uangnya ya. Nanti kalau di otomatis di debit nggak ada uangnya ini menjadi pusing ya. Nah, yang terakhir dengan members ya, peserta itu kita ada mobile JKN, tidak hanya mobile JKN, ada iCare JKN, ada macam-macam. Ya, cuman tadi sudah banyak yang mulai akses mobile JKN. Yang terakhir itu ada namanya Vitality Application. Jadi kalau kita berjalan, berapa energi yang keluar, berapa kalori dicatat. Detak jantung yang sehat berapa dicatat. Ya, tentu kalau Mbak Azizah saya yakin belum itu. Ya, belum kan? Belum tahu. Ya. Baik, berikutnya, karena sudah pakai jam mungkin ya. Kata Bu Retno, kata Prof Retno sudah pakai jam. Berikutnya, slide, ya. Nah ini we are now conducting quality transformation. Kualitas transformation itu ceritanya kalau pakai conceptual framework ada donabedian ya, yang sulit ya, ada input, proses, struktur, output, ya outcome. Tapi BPJS bikin yang sangat sederhana. Ukurannya cuma 3, mudah, cepat, setara. Mudah, cepat, setara. Convenient, fast, and non-discrimination. Jadi sekarang kalau dirawat di rumah sakit, didiskriminasi, boleh protes, boleh komplain. Bahkan peserta BPJS sekarang bisa kasih rating ya, kasih bintang. Kalau pelayanan perawatnya nggak bagus, kasih bintang 1. Itu ada tuh. Dan semua di-capture ya oleh BPJS. Itu sebuah rumah sakit kok bintangnya 1. Kenapa? Katanya di situ dicatat perawatnya cerewet. Ini ditulis gitu. Pasti bukan lulusan UNAS itu ya. Kalau lulusan UNAS mantap ya. Oh. Gitu. Berikutnya ya. Boleh dilewati waktunya kelamaan nanti. Nah, ini aplikasi mobile JKN yang banyak sekali ya. Kita bisa membership profile, digital card, bisa new member registration, ya, information complaint bisa, ya, komplain di sini, many, medication list, basic health screening, ya, macam-macam, ya. Saya nggak usah jelasin satu-satu, waktunya tak ada. Berikutnya, ya, ini e-health record di mobile JKN. Jadi mobile JKN itu sekarang sehari Anda pasti tahu dirawat di mana, diagnosisnya apa, obatnya apa. Terus kalau penyakit wound, di treatment apa, ada di situ. Luar biasa. Yang tidak biasa, banyak yang belum tahu, gitu aja. Berikutnya, jadi health screening, health record, ya. Jadi kita sekarang ada akses health through mobile JKN, berikutnya. Sudah 39 juta lebih, ya, termasuk beberapa dari UNAS tadi. Berikutnya, ya, yang cepat biar terima kasih gitu. Mana? Ya, ini, waduh, perkembangannya luar biasa, ya. Sekali lagi, ada biometric fingerprint, ada telekonsultasi, elektronik SIP, ya. Bahkan terakhir ini, kalau ke fasilitas pelayanan kesehatan, bisa yang penting bawa muka, ya. Namanya Frista atau face recognition. Bawa muka, langsung perawatnya tahu dia peserta BPJS bukan. Iya, ini tepuk tangan ini. Yang penting, ya, ini masyarakat sudah tahu, maka UNAS harus tahu, ya. Yang penting datang bawa muka, jangan sampai datang jangan sampai ini profesional datang nggak bawa muka, cuman tubuh tok, wah nanti perawatnya bisa lari, ya. Nah, ini masalahnya. Asal bawa muka langsung di capture, ya, sama readernya, tahu dia peserta BPJS bukan, gitu. Berikutnya, nah ini iCare JKN, ini luar biasa. Periksa di Jogja pamannya, tahu diagnosisnya apa, treatmentnya apa, obatnya apa, dokter di Jakarta bisa tahu. Luar biasa ini. Cuman yang tidak biasa sekali lagi banyak yang belum tahu, ya. Berikutnya, ya. Dan belum pakai, tapi sudah ada 39 juta, ya. Coba kita dengarkan, ya, dari berbagai negara pada datang.
Coming to see the command center, I brought the command center also. Something that is remarkable. I mean, it helps you to get a feel of what is happening on the ground, and then how to be used also to drive the movement and all. I think I'm highly impressed.
So to come back to Indonesia and to see the JS now and what it's achieved is really quite impressive. So I congratulate everyone who's worked on the JS. It's amazing to see the level of coverage across the country and to see the attention to equity and meeting the needs of the population. And I think I'm still learning about the JS, but what I can say is I'm impressed with how much it is innovative and testing and experimenting with new things. To me, the things that are most exciting are the things that make healthcare different for the individual. So making access easier, bringing services closer to the individual, to the community. I think the way that the JS is innovating and finding ways to do that, that's what it's
impressive. So the coverage that the UBS has is something that many countries aspire to achieve. So in many ways, it's a place that we can look to learn and see what they've done here that we might be able to transfer and use in other parts of the world that are not as far along in the different aspects of health. The integration between levels of the health system and from providers to UBS is something that really stood out. So the way that the technology has been used and information is shared to provide better care for the population is something that's been really impressive and I'm excited to learn more about.
I was really impressed by the digital transformation, and I can't imagine how they handled 1 million insurance claims a day. So I was very impressed by how efficient the leadership, how efficient the management of everything was. So I think Indonesia feels with JKN has not only been aspirational, but it's also been inspirational to a lot of countries which come from the same context, low and middle income countries that are aiming to achieve universal health coverage. The experience that Indonesia has had is provides invaluable lessons to many countries that are on the same path, which Indonesia has almost achieved near universal.
decreasing our public expenditures, improving sustainability quality, as well as improving efficiency. So I think the world is looking towards Indonesia for your country experiences and how we can go back and emulate the same in our country. BPJS keren.
BPJS kesehatan keren.
BPJS kesehatan keren. Pidato dari Malaysia tuh. BPJS keren. Iya. Bahasa Inggrisnya BPJS is cool. Jadi sekarang ini betul-betul berubah BPJS. Jadi harus kita sudah mulai tahu karena masyarakat sudah mulai tahu. Next slide. Tidak hanya itu, di berbagai universitas kelas dunia ya, seperti John Hopkins, Harvard, Oxford, pada ngundangi BPJS, Pak. Untung UNAS juga ikut ngundang itu. Tepuk tangan untuk UNAS. Karena kalau enggak ketinggalan zaman. Karena universitas kelas dunia aja ngundang, apalagi universitas nasional ya, apalagi universitas di kelas nasional ya, seperti UI, ITB. ITB jarang ya diskusi tentang kesehatan. Yang diskusikan itu teknik. Tapi kali ini ngundang BPJS ngomongnya kesehatan, Bu. Baru 3 hari yang lalu ya, kita ke UNPAD, diundang untuk memberikan banyak sekarang diskusi di universitas. Terakhir ya, mungkin sebelum terakhir berikutnya, kita ya bagaimana good practice ya di dalam BPJS. Ini dari ISA, coba kita lihat. Terakhir sebelum kita akhiri. Jadi BPJS itu ya mengikuti ini kompetisi di
Yes, now the winner can be announced. So I would like once again to congratulate all member institutions who took part in the competition. It was impressive to see the range and scope of the submissions. The one award we have not yet announced is, of course, the overall winner. So, from 168 entries in the jury had to select one that was outstanding and deserved to be awarded as the winner of the competition. So it is my great pleasure to announce the winner of the ISA Good Practice Award for Asia and the Pacific for 2021. The winner is the Social Security Administering Body for Health, BPJS Kesehatan Indonesia, for its National Health Security Program.
Ya, jadi katanya itu terbaik se-Asia Pasifik gitu. Sorry itu kalau begitu ya. Ya, jadi dengan apa namanya artinya prakteknya itu baik gitu. Dan itu diakui oleh ISA, sekjennya yang umumkan, International Social Security Association, anggotanya 162 negara. Ya. Iya. Mas Heru, udah dibuka. Iya. Ya, sekarang terakhir, karena banyak yang belum tahu tentang BPJS, makanya Dirutnya bikin lagu belum tahu. Judulnya belum tahu, di YouTube ada. Ya. Nah, dinyanyikan oleh rektor UGM. Ya. Kenapa? Karena sebetulnya kita inginnya meng-hire profesional yang suaranya bagus, bikin videonya bagus. Kalau bikin tari yang bagus seperti UNAS tadi ya. Cuman masalahnya nggak ada dananya, nggak disetujui oleh Kementerian Keuangan. Dananya ada tapi persetujuannya nggak ada. Makanya terpaksa Dirutnya suaranya jelek, bikin sendiri gitu. Mari kita dengarkan dan rame-rame yang bisa ya, ada di YouTube. Mari disetelkan, mana nih? Isinya bahwa BPJS itu sudah maju ya, tapi banyak belum tahu. Persepsinya masih pikiran untuk kelompok tertentu.
Nah,
tertentu. Mereka yang tidak mampu, padahal sistemnya sudah menyatu. Oh, kamu belum tahu, di rumah sakit ada BPJS 1. Mereka siap membantu. Tolong kamu cari tahu. Teknologinya sangat jitu, riwayat medis yang ditanammu membantu doktermu dan kamu tiap saat tahun lalu. Jelas persepsi yang masih keliru jika paskesnya masih begitu. Layan kita seperti harapanmu, laporkan saja ke BPJS 1. Oh, tak perlu BPJS-mu. BPJS tidak urus itu. Menjamin akses tanpa waktu. Semoga kamu jadi baru. Mesti kamu dan keluargamu jadi peserta yang saling bantu. Jangan lupa jaga selalu kesehatanmu dan keluargamu.
Jadi mohon maaf ini suara jelek, nggak bisa bikin lagu, terpaksa karena nggak ada dananya. Kalau di Jogja ada Danawati. Ya. Nah, karena di Jakarta nggak ada. Loh, terakhir ya, ini khusus saya bacakan pantun. Loh, belum kok udah cakep, belum. Berjalan pagi di tengah taman kota. Angin sepoi terasa sejuk hingga dada. Di UNAS bertemu peserta ICAS yang mulia. Mari bersama majukan ilmu dan karsa. Terakhir nih, pergi ke hutan mencari rotan. Singgah sebentar di tepi pantai. Perawatan luka perlu ketelitian agar pasien pulih dengan cepat dan baik. Terakhir ini saya mau kasih buku, tapi tidak semua yang bisa jawab pertanyaan. Ya, oh ada 3 ya, oke. BPJS Kesehatan yang luar biasa, di bawah kementerian mana di Indonesia ini? Angkat tangan yang bisa. Tadi sudah saya jelasin. Kalau yang ngobrol sendiri, ya nggak tahu, pasti belum tahu. Ada yang jawab, kasih buku. Di bawah kementerian mana BPJS Kesehatan? Ya. Nama sebut. Ya, di bawah kementerian mana?
Assalamualaikum warahmatullahi wabarakatuh. Izin Bapak, perkenalkan saya Selva dari mahasiswa Nurse Angkatan 11.
Nama?
Nama Selva.
Selva.
Ya.
Oke.
Izin menjawab, BPJS berada di bawah Kementerian Kesehatan Republik Indonesia.
Iya, salah. Enggak jadi. Salah. Iya, ini depan, ya. Mau salah. Tidak di bawah Kementerian Kesehatan, ya. BPJS adalah setingkat menteri, gitu ya. Jadi, oke.
Assalamualaikum warahmatullahi wabarakatuh. Mohon izin Bapak, saya Devi Kurniati dari program Magister Kebidanan kelas C. BPJS di bawah Kementerian Ketenagakerjaan.
Ya, salah lagi. Ya. Tadi sudah saya jelasin. Ya, silakan. Silakan, ini. Karena nggak dengarin ngobrol waktu dijelasin.
Ya, Assalamualaikum warahmatullahi wabarakatuh. Saya Lia Prianti dari Magister Kebidanan Nasional University Indonesia. Saya ingin menjawab pertanyaan.
Siap.
Bismillah, mudah-mudahan benar ya Pak. Jadi di bawah naungan Presiden.
Betul.
Ya. Kalau karena setara dengan Menteri gitu ya, Pak.
Jadi
Terima kasih.
tidak di bawah satu kementerian pun. Ini berbeda dengan Malaysia yang tax based system ya. Iya, jadi berbeda. Kasih buku. Ya, tepuk tangan. Satu lagi ya, ada dua sebetulnya. Jadi berapa orang sekarang yang menjadi peserta BPJS dalam bentuk angka dan persentasenya? Kalau tadi nyimak pasti tahu, pasti semua udah saya jelasin. Tapi kalau ngobrol ya nggak tahu, nggak dengerin. Siapa tahu berapa jumlah peserta BPJS ya? Ya, sini. Kalau jawab tidak kita kasih ya, karena kita bingung ya. Harus angkat tangan ke sini jawab. Ya. Nama?
Perkenalkan, nama Luzi Febriani dari S2 Kebidanan. Jumlahnya 187 juta orang. 187 juta orang.
Ya, salah.
Hah?
Salah. Ya. Ayo, ini ya, yang tengah, ya, tengah. Karena banyak yang nggak tahu BPJS sudah maju ya. BPJS itu luar biasa di dunia loh ini. Ya.
Ini benar nggak ya?
Ya.
248,7 juta.
Berapa?
248,7 juta.
Ya, belum pas.
Ya.
Berapa persen?
90%.
90%? Iya, salah. Salah. Iya, tengah, ya. Pokoknya kalau dengarkan tadi pasti tahu lah. Udah saya jelaskan.
Assalamualaikum warahmatullahi wabarakatuh. Saya Febriani, mahasiswa S2 Kebidanan dari Pandeglang.
Siap Mbak Yuliati. Ya berapa?
276.520 triliun juta 276.520
Oke, berapa persen?
98%.
Mantap, benar, kasih buku. Jadi bukan ribu loh ya, juta. Ribu sama juta itu beda banget ya. Penduduk Indonesia itu 280 juta. 277 juta sudah di-cover oleh BPJS. Sudah 98% ya. Sayang tadi nggak ada ininya. Terakhir ya. Apa judul lagu Wah. Sebentar. Pertanyaannya belum. Sebentar. Ya. Kok belum tahu? Belum tahu ya jangan angkat tangan. Yang sudah tahu yang angkat tangan. Ya, judul lagunya tadi kan belum tahu, ya kan? Isi yang paling terkesan apa? Silakan. Siapa? Ya, siapa yang silakan angkat tangan. Belum pertanyaannya belum udah angkat tangan. Iya, apa? Boleh.
Assalamualaikum. Mencoba menjawab. Tadi isinya BPJS nomor 1. BPJS 1 bukan nomor 1 ya. Isinya prinsipnya BPJS itu 1 seperti itu.
Bukan, salah. Mosok BPJS 1. BPJS memang benar BPJS 1, tapi ada di setiap rumah sakit ya. itu ada BPJS 1, itu orang ya, yang siap membantu. Iya itu, nah, belum tahu, kerja di rumah sakit masa belum tahu, lihat. Nah ini, karena apa nggak dengerin? Ya.
Assalamualaikum warahmatullahi wabarakatuh. Nama saya Rini Kadarwati dari S2 Kebidanan kelas B.
Ya, Wati.
Yang terkesan untuk tadi lagu aku belum tahu itu bahwa BPJS tidak menjamin apabila ada kesalahan di dokter lama atau tidak. Tadi tuh terkesan seperti itu.
Gimana BPJS tidak menjamin?
Ya, jadi kalau misalnya ada kayak dokternya telat atau apa, itu tuh bukan tanggung jawab BPJS karena BPJS itu.
Kalau apa? Nggak jelas.
Jadi begitu.
Agak jauh dikit.
Oh,
nah.
ya. Tadi lagu yang terkesan itu yang saya dengarkan,
Ya.
lagunya itu BPJS tidak menanggung apabila ada kesalahan pada petugasnya. Seperti tadi Bapak contohkan, dokternya telat gitu kan. Itu bukan tanggung jawab kami BPJS, seperti itu tadi.
Iya, tapi sebetulnya kurang pas ya.
Kurang pas.
Jadi gini ceritanya, itu bukan tanggung jawab BPJS kalau dokternya itu telat ya.
Telat.
Kosong, obatnya kosong. Kenapa? Karena itu bukan urusan BPJS. Urusan BPJS itu untuk menjamin akses tanpa doku. Ya, mungkin ya, itu ya. Tapi bagaimanapun dia sudah berusaha ya. Kita kasih bukunya.
Terima kasih Prof.
Ya. Tidak terkesan ya. Tapi bukan ya, bukan kalau nggak sesuai prosedur, bukan. Tapi BPJS itu sering disalahkan bahwa ini antri gara-gara BPJS. Ini dokternya nggak ada gara-gara BPJS. Obatnya kosong gara-gara BPJS. Semua salah karena bukan tanggung jawab BPJS. Gitu ya. Ada yang tanggung jawab tentang itu, gitu ya. Ini ya baik karena waktunya dan ini mohon maaf agak melompat sedikit ya. Terima kasih. Akhirul kalam. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you to Professor Dr. Ali Gufron. But please stay on the stage first because the next event is the handover of token appreciation from the conference committee.
We invite the Dean of the Faculty of Health Science, Ibu Profesor Dr. Retno Widowati, and Professor Valida Mosaid from Lincoln University, Malaysia, to come to the stage and give the token of appreciation to Bapak Professor Ali Gufron as our keynote speaker for today.
Okey, saya ingin mengucapkan tahniah, congratulations kepada BPJS kerana telah membuat satu lonjakan kepada yang lebih tinggi ya. Ini berisiko, ini Prof Ali ini berisiko untuk menjadi Menteri Kesihatan ya.
bukan berisiko untuk mendapat penyakit, tapi berisiko menjadi menteri. Okey, dan kerana ianya bukan luar biasa. Kalau luar biasa itu abnormal, betul ya? Luar biasa, translationnya abnormal, tetapi dia luar dari biasa, maknanya lebih tinggi. InsyaAllah. Ya, ya. Terima kasih.
Jadi maksudnya bukan luar biasa, karena luar biasa itu tidak normal, tapi luar daripada biasanya luar biasa.
We also invite all of the speakers and moderator to come to the stage to take a pictures.
Please welcome to all of the committee to take photo with the keynote speaker and invited speaker, please. One more. Sebelah tunggu. Nasional. Thank you for all. One more, with all the participants, please stand up. We can take photo. Prof, kembali ke front. One more, please, from here. With the participants.
And for all of the participants in the auditorium, please gather together in the front area because we will take one of frame pictures with our speakers. Don't forget to smile. Para peserta mungkin boleh agak ke tengah sedikit, boleh bergeser agak ke tengah.
Ya. Tolong dipenuhi bagian tengah lebih dahulu, please.
Halo, peserta yang di sudut bisa ke tengah?
Para peserta diharapkan untuk lebih ke tengah.
Sudah, jangan lupa senyum. 1, 2, 3. Lagi. 1, 2, 3. 1, 2, 3.
Thank you very much.
Okay.
Thank you. You all may return to your seat. Thank you. You all may return to your seat.
Before entering the next series of event, we would like to say thank you to our sponsor, BPJS Kesehatan, Tupperware, Cimori, Fitbar, Ikan Dorang Minyak Goreng, Keju Bell Cube, Stimuno, Mirea Frozen, Wardah, Mie Sedap, Top Kopi, Beyondly, and Medco Fazin. We would like to express our deepest gratitude to all sponsors who have participated and support for today's event.
For the first session of the conference, it will be guided by Bapak Dr. Nurse Dayan Hisni, Askap MNS, as our moderator on the topic of harnessing modern and complementary wound care treatment, current and future direction, and teamwork in wound care and wound care nursing.
Bapak Dr. Dayan Hisni Eskep MNS is a lecturer at Nursing of Study Program Faculty of Health Sciences, Universitas Nasional. His education background, bachelor and nursing profession from Universitas Jenderal Sudirman. Master of Nursing Sciences from Prince of Songkla, Universitas Thailand. And Doctor of Nursing Sciences from Universitas Indonesia. His research area, diabetes nursing, self-management in patients with diabetes mellitus, how to prevent diabetes mellitus complication and other topics in diabetes mellitus. His research method interest mixed method research, RCT, and qualitative study.
Kepada Nurse Dayan Hisni Askap MNS, kami persilahkan.
Thank you, MC, for introducing me and giving a time to continue the seminar today. So, ladies and gentlemen, please have a nice seat. And today we are going to discussion in the first session with the valuable speaker. So, before we start, allow me to introduce the speaker first. I'm Dayan Hisni, the moderator of today's seminar. I'm very pleased to see all of you here. Today's seminar is about, there is no title here, yeah? Okay. Okay. I forgot also, yeah. Okay, the title of the seminar today is Wound Care Management and Complementary Therapies in Holistic Health across the Asia region. So, for your information, this seminar is divided into two sessions. Yeah. The first session, we have two speakers. The first from Malaysia and the second one from Turkey. Yeah. So let me introduce the speakers in the first session. They are first, Professor Dr. Farida Muhammad Said. She is a professor in nursing from Lincoln University, Malaysia. She has received her bachelor degree from University of Malaya, master degree from University Kebangsaan Malaysia, and taken her PhD at University Putra Malaysia. To Professor Dr. Farida Muhammad Said, please come to stage.
semasa Daya naik, riuh di belakang.
So please big applause for Profesor Farida. Yeah.
Ini berkemungkinan ada gender bias di sini. Apabila lelaki naik, male naik, wah bisingnya sebab ramainya itu perempuan di sana. Bila perempuan naik, enggak ada. Alright.
Okay. Thank you, Prof. Farida. Please be nice seat. And then the second one, the second speaker is from Turkey. She is Assistant Professor Dr. Fildan Çakar, RN, MSc. Dr. Fildan Çakar, are you stay in Zoom, already in Zoom? Can you hear me, Dr. Çakar? There is no sound from her. Yes, okay. Okay, let me.
I can hear you well.
Oh, okay.
Morning.
Morning.
I
Good
can hear
morning.
you. Good
Yeah.
morning.
Okay. Okay,
Bye.
let me introduce her. Let me introduce her. She is graduate Bachelor in Nursing from School of Nursing, Ankara University. Then continue to master degree in health management at Marmara University, Institute of Health Sciences, Istanbul, Turkey in 2005. And then she got a PhD in nursing from Koç University, Istanbul University. So please be sit in Zoom, Dr. Fildan, yeah? Okay.
Yes.
Okay, well, before the presentation begins, let me inform how the presentation will be going on. Okay, first, all speakers in the first session will be invited to present their materials. And then each speaker has 15 minutes to present the topic. And then after that, there will be question and answer session and followed by conclusion. So now allow me to welcome the speaker, Professor Dr. Farida, to deliver her presentation. Okay, your presentation about harnessing modern and complementary wound care treatment. It's okay, you can sit here or it's up to you. Okay, okay.
You're going to share the slide? Are they going to share the slide? No, it's okay.
The slide is committee, just to...
Yeah. No, but this one for me to, so that I don't have to look up there. Okay.
You need pointer?
No, I have.
Oh, okay.
You bring this mic or this one?
Can I on?
The slide is okay? Ready? Okay. Slide, please. Okay.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Okay. Semua sudah bersedia ya? InsyaAllah. Okay, bismillahirrahmanirrahim. Ini tanda-tandanya nervous ya? Alright. Okay, remember hari ini saya cuma bukan, I'm not going to give any lectures, we're not going to have, we are going to share. For me, the principle of sharing is very important, okay? Okay, because everybody is very engrossed with the digital or AI, so I have to put my face younger than what I should be. So it is my face with the modification, all right? Okay, next slide, please. All right, so what I'm going to cover is that we're going to cover 4 areas here, a bit of an introduction, wound healing, complication of wound, and the role of the treatments. Next, please. Okay, if you look at now, wound is one of the agenda where we have hidden epidemic there. Why we said hidden epidemic? Because we are not sure how many of us who are at risk, even though some people knows that they are at risk of the wound. And you look at the current situation here, we have more people at risk, especially those people who have diabetes, who have PAD, peripheral arterial disease, and of course, all people with heart disease. So if you look at any statistic, I'm not going to go through, we have a lot of those people who are very at risk. So we have to keep in mind as a healthcare provider, those people are at risk, okay? Annually, chronic wounds affect mostly about 40% of the worldwide, 40 million, which we estimated that at least 1.3% adults are at the high risk. And those people with that 65% is 3.6. And of course, those people who are 80, they are more than 5% at risk because of their conditions, the comorbidity, as well as they are at risk of that precious salt, okay? And the problem here is that currently we have many patients, not only the elderly, not only on diabetic, but we have all those young patients who have all those risks of burns. The next one, please, next slide. All right, so we have many cases of burns, especially those from the younger generation, okay? And you know that wound repair is an orchestra. Why we say an orchestra? Because it takes many duration, and it takes many times, and it gives a lot of process in order to have that good wound care. All right? But why we are so concerned about the wound? Remember, we already saw that how much the ministry spend on the healthcare. You know, every year we increase in our spend in the wound, not on in the disease prevention, disease treatment, which will affect on the economy of all the countries. So the impact of wound, of course, and we said that, the next one please, next slide. Okay, the impact of those wounds is that, of course, we are talking about the budget. Just now, our future Minister of Health already mentioned about the budgets, all right? We also have the mortality and morbidity. We see that the number of people has this wound pandemic is increasing. Of course, the impact of the wound is the quality of life for people who is suffering from the wound problems, okay? Such as high risk of amputation, the emotional distress, physical distress, of course, the financial cost. Because you have to go to the hospital, you have to go for the treatment, and remember, each year the cost of health treatment is not going to go down. It always coming up rather than it's coming down. Next slide, please. Just to recap, what is wound? Because if you say that wound is any break of the skin, that one can cause some eruptions. It can be visible. So in terms of that definition, there's a break of skin. So even the pimple also we can consider them as wound if it is not well treated, all right? And as a care providers, those who are going to provide the nursing or whatever wound care or whatever you're going to provide the health care, we have to, next one please, sorry. We have to know what are the classification of the wound. Again, there are different types of classification. It based on who are the person who give the classification. But basically, we have three classifications here based on the origin of the wound, for example, the mechanical wound, chemical wound, and so on, and also based according to the bacterial contamination, whether it is septic or non-septic, and also depend on the depth of the injury. This is the basic classification, right? Next, please. However, there are different healthcare providers who have a different classification. What they have is that the additional of the wound age, all right? Whether it is a new wound or is it the old wound. Because we know that, the old wound and the new wound have some impact on the health of the patient. Next, please. All right, now we look at the healing process. What is healing? So it is a process when the injuries, the tissue of the injuries is trying to recover so that it can heal without any problem, and they have 4 stages. So I'm not going to go through that because each of those stages have its own mechanism and it has its own durations there, all right? But remember, the healing process will be affected by the patient itself and by the healthcare provider. We're going to discuss on that later. Next, please. All right, as a healthcare providers, this is very important. We have to know the different types and stages of healing because it will help you in terms of your treatment. We have primary healing and secondary healing. We are not talking about the wound now. We are talking about the healing now, okay? So if you say primary healing, it is understood that primary healing is more of those uncomplicated wounds, whereas the secondary is more on the complicated wounds, all right? Next, please. Next slide. All right. So I just want to remind everybody that, as the care provider, we have to be aware of all those complications. So when you do any dressing, your main role is to assess the patient's wound, whether it is primary or secondary wounds. Number 2 is that if it is secondary, is there any sign and symptom of complication? It is very, very important because it will, helps you to decide what type of dressing that you're going to provide, all right? Next, please. All right. So what are the factors that are affecting the wound healing? There are many factors, but we would like to classify them into 2 factors. One is local, one is systematic. Okay. Local means that the site of the wound, the mechanism of the wound, remember I mentioned about the different types of wound? So this is all the local factors. Whereas the systematic factors, such as the age, malnutrition, the obesity, the lifestyle, as well as the care provider, that is the systematic factors. So if the patient is very old, the risk of poor healing is there. If there is a risk of poor healthcare provider, the risk of poor healing is also there. So we know what I mean by all those things, all right? Next, please. All right, so if you look at here, what I'm trying to explain here is that this you can get from any of those research papers. So this is all the factors that affecting on the wound healing. But I would like to, because now I would like to highlight on the healthcare professional factors. Because we are the healthcare professional factors. Remember I said about the systematic factors? So we are one of the factors. If you have a very good skills, do you think that wound will be healing fast? Yes or no? What is you mean by the skills? You have a very good aseptic technique, a very good dressing, very good assessment, so the healing will be faster. If you have a very poor assessment, poor knowledge, the healing will be affected by our care. All right, next one. All right. So what is the wound care treatment, the best wound care treatment for those patients with wound, the non-healing wounds? What would be the best approach? Is there any specific approach? Anybody? No, actually, again, as we said, factors that include that influence on the healing, there are two factors there. Remember, we are talking about the systematic factors as well as the local factors. Okay, common treatment approach, we have two common approach. One is, the most importantly, as I said, the skill, the assessment and the documentation. It is very, very, very important, because when you have a good assessment on the patient's wound, you're going to have a good documentation, then you're going to have a good dressing and good treatment for the wound. Then only it can improve on the wound healing. Cleaning of the wound, again, it based on what is your skill. And okay, the other things, you know, debridement or removal, selections, application, that is depend on your skills and your knowledge. But I would like to stress on the last one, patient, caregiver, family members, education and empowerment. Remember, we in Malaysia, we try to focus more on the patient empowerment, because if you can provide the best care, but if the patient themselves has not empowered on how to look after themselves, so we're going to have a very long process of recovery, okay? So whatever it is, treatment modalities also depend on the new technologies, the new evidence base. So you can have many, many different types of treatment. The best treatment is not necessary for everybody. It depends on the patient status itself, all right? Next, please. Next slide. All right, wound treatment management, which is the best? I'm sure those who are the care providers, they also not very sure of the best treatment. Next, please. All right, but the most important, the best is that the provider principle of wound management, that is the best. You have to know what are the 5 principles of the wound management, such as wound assessment, wound dressing, and so on, and also your mission and vision of that wound care. We have to prevent the infection, you want to make that healing faster, you have to avoid any complication, you have to minimize the pain, because if you do dressing in a way that patient feel pain, they will not come again for the next appointment, all right? And of course, we have to prevent the scars. Okay, next please. All right, you can find this in many of those research. They said there is different modalities, or you must have all those in your mind when you want to do the dressing. You see, all those ideal wound dressing features must have all these characteristics. The dressing must be able to remove all those dirt, and it provides the moisture so that it can improve on the healing. And there must be some gas transmission so that it can improve on the healing process. The mechanical stability of the wound dressing, low adherence to the skin to reduce pain, wound necrosis reduction to improve on the healing, pain elevation so that the patient will come again for your next appointment, non-toxicity of the dressing so that it will not give any discomfort to the patient, cost effective because you can have any other expensive treatment, but if it is not cost effective, is not suitable for the patient. Biodegradable, biocompatible, and of course, the most important thing is that infection prevention. Next, please. All right. So today our aim is, we know that there are a lot of new technology of the dressing, and at the same time we also have that complementary alternative medicine, all right? So how are we going to combine? How are we going to close the gap? So because you know that some of those, the alternative complementary medicine do have the property of healing. So how are you going to do that? All right, next. Okay, actually when you look at the olden days of wound care, it is already been stated that, you know, those days, they also believe in terms of cleaning the wound, sticking the plaster and bandaging the wound since 2200 BC, all right? And they also believe in terms of how to clean, disinfectant of that wound, because they use all those, what you call that, necessary solutions to prevent any infection. Even the current, the simple solution that we use is that we use salt water, all right?
Excuse me,
Next.
Prof. Excuse me, Prof. 3 minutes left.
1 minute?
Okay, it's okay.
Okay.
Continue.
Next one. Okay, this is one of those, you can read into, I'll give you some of those website you can go look through. So this is some of those studies that shows that how the natural product can improve on the healing. Next one. Okay, however, as what we said that, you know, some of these, they have some limitation. You can read on that, what are the limitation. One of this is that, you know, they have not have the consistency, the sustainability of the property in terms of healing. The next one. Okay, next one. Okay, this is the modern dressing where it is been certified that it is safe and cost effective. Can you go next one? Okay, next. All right, the next one. Okay, so many studies have shown that, you know, wound, the traditional have some effect on that. Okay, the next one, please. And then we have the modern wound care. I think everybody is quite aware. Okay, next one. Okay, now we're going to look into, now I'm the supporter of our future Pak Menteri Kesihatan itu. So the future trends of wound care. Next one. Various studies have shown that, you know, the power of technology, advance in health equity, and AI has improved in terms of wound care. Next one. All right, next. So what are the future? Even in America, they already started with the digital wound care. I remember I already told one of my students, can you please create the application for the wound care for the use of the next generation. Can you please go? Next one. Next. Okay, they also use the robotic for the wound care. All right, you can read all those in this website. Next one. Okay, and the next one. However, even you have all those jitter, but I would like to stress on all those care providers You have to empower the patients on the lifestyle changes, stop that carbohydrate or whatever that can lead to their diabetes, the nutrition, the healthy diet, medication compliance, wound care at home. So we have to encourage the patients to help themselves with their own wound care, all right? Shared wound care, educating relatives as well as educate good practice to patient, all right? Next. In conclusion, we see that, even though we have all those modern and traditional and the future, but most important thing is that those care providers as well as the patient must play the very important role to ensure that the healing process of the wound is well advanced. Okay, next. So this is some of Lincoln contribution in terms of the wound care. We have so many of our students are doing on wound care. One of those is our Nasia is doing on electrical stimulation and citrus essential oil. And one is doing on the comparison between the healing process using the HEPA sulfur with aloe vera. And the other one is combination of ozone infratherapy with honey mixed olive. So there are so many ways. That means that wherever you are doing, you must be based on the evidence base. All right? Okay, next. So the take-home message is that sustainable goal of the provider, prevention strategies for wound management, empowerment of the patient, the lifestyle changes, and empowerment of the provider, enhance new strategies, knowledge, and skill for the sustainability of the goal. Next. Next, please. So, how to sustain our care? We have to do a lot of readings. You have to follow some of those guidelines. Okay, next. All right. With that, I will say thank you so much.
Thank you very much. Give applause. Yeah. Okay, thank you, Prof. Farida, for the nice presentation. And I think her presentation is very, very nice, yeah, because she present about the history of wound, time by time, and now, present, and the future of the wound care management. So please be seated, Prof. Farida. Okay, for those who have some questions, please be kept. We have question and answer sessions after the second speaker done. So we move to the second speaker. Okay, the second speaker is Assistant Professor Dr. Vildan Chakar, RN, Master of Science, to deliver her presentation about teamwork in wound care and wound care nursing. To Dr. Vildan Chakar, time is yours.
Thank you. Can you hear me well, Dr. Hisni?
Okay, yeah, start your presentation, please. Yeah.
Okay, can you hear? And I think you can see my screen, right?
Yeah.
Okay. I try to make it full screen, but I can't succeed. Let me do it again. Just give me a second.
Okay, Dr. Vildan.
Okay. Can you see?
Yeah, we see your presentation.
Okay, but there is a problem. I can't move my animations in my slides. I can't make it full screen. Just give me a second. Okay. I don't know why. I try to finish immediately. Thanks for your understanding.
You're welcome, Dr. Vildan.
Okay. It's okay now. Thanks to organizing committee for inviting me for this excellent event. I would like to be there in person. I hope next time. Good morning and greetings from Istanbul, Turkey, in which the city center of the civilizations. Firstly, thanks for this great introduction about me. Let me briefly introduce myself again. For over 20 years, I have served in different nursing fields focusing on infection control and wound care areas. I'm currently continuing to share my experience with nursing students and colleagues as a trainer. And I will try to cover my topic within this framework for today. The term chronic wounds was first used in 1950s, and chronic wounds refers to wounds that were difficult to heal or did not follow a normal healing process. And as the professor mentioned earlier, it's a complex and orchestrated process, and it's run by bodies itself. And various alternative terminologies have been suggested to describe chronic wounds, such as hard to heal wounds, difficult to heal wounds, non-healing wounds, and complex wounds. And chronic wounds are classified based on their causative etiologies, and various classification systems were developed by scientists. And the most common wounds that are encountered in different clinical settings: pressure ulcers, diabetic foot ulcers, venous ulcers, and arterial insufficiency ulcers, and so on. And chronic wounds have also significant effects on humanistic and economic burdens at individual, social, and system levels regarding decrease in quality of life of the patients and their families, loss of labor, loss of functionality, increase in mortality, increase in healthcare cost. And because of all of these negative consequences, chronic wounds are a global health concern and hidden pandemic. And it is estimated that according to studies, between 27 to 50% of acute hospital beds are likely to be occupied on any day by patients with a wound. And total cost of wound care accounts for between 2 to 4% of European healthcare budgets. Of course, every country has different type of numbers and prevalence and incidence numbers according to their disease information and health statistics, of course. And recent meta-analysis study revealed that the global prevalence of pressure ulcers is almost 13%, with the hospital-acquired incidence almost 9%. And according to data obtained from American Quality Studies, 60,000 patients die from pressure ulcers, and more than 70,000 lawsuits filed each year, and pressure ulcers are at second place after accidental death. And these numbers are quite important in order to indicate the magnitude of the chronic wound problem. And according to International Diabetes Federation, again, diabetic foot ulcers are the most common complications of patients with diabetes mellitus. And these ulcers are responsible for more admissions than any other diabetic complications. Our previous presenters is also shared regarding this type of numbers and epidemiologic informations. And healthcare professional related factors and resource related factors affect the wound healing process. As a result of that, A well-structured and empowered wound care team is essential for wound management activities. And in order to be effective wound care team, firstly, the teamwork concept must be understood well. Typically, teamwork can be defined as a group of people with complementary skills who are committed to a shared goal, performance objectives, and approach for which they are mutually accountable. We need to understand first definition of team concept so that we can drive our wound care activities according to this theoretical framework. For a functional teamwork, roles, responsibilities, functions, and authorizations should be well defined to prevent confusion and communication errors in our studies. Goals, targets, and outcomes are measurable and sustainable within the scope of shared goals. Team members trust each other and they believe in effective communication, continuous improvement, and collaboration. Why do we need teamwork in wound care? Increased prevalence and incidence of multiple chronic disease. We already know effect of multiple chronic disease in the development of any chronic wound and its healing process. Patient safety-centered healthcare approach. This is very important for today's healthcare. And positive effect of multidisciplinary intervention in chronic disease management. And increased prevalence and incidence of non-healing acute and chronic wounds, and the different specialized care needs of each wound and patient. Lack of integrated services aiming to meet all healthcare needs of individuals with wounds make vital the team approach in wound care. As you can imagine, all these factors, all these informations are closely related to wound care activities and wound care needs. And in order to provide patient-centered, safe, effective, and fair wound care, everyone, including patients and their families, must be involved in a well-organized team effort. And organizations, facilities, institutions, hospitals, governmental authorities, governmental activities, and regulations must support these studies and healthcare providers. Otherwise, we can't mention about any well-structured team-based wound care activities. Everyone must be involved who are active or receiver or provider of the system. According to that, it is expected from this team protecting and maintaining skin integrity, regulating overall health status and disease management of the patient, achieving and maintaining a state of well-being of the person quite crucial. And in this context, team members must be selected according to the patient needs and demands and must work in a continuous cycle with a cooperation with patient and other team members. And the regular assessment of the patient and process must be performed, and this regular assessment is guarantee of the wound care activities are working or not. And to ensure good teamwork, some aspects should not be forgotten. Always keep in mind. A single model approach may not be appropriate for all organizations. That means team members may change according to patient needs, and a leader and one more than leader or responsible person should be lead the process. And available resources, access to relevant expertise, payment system, patient group characteristic, and basic principles of care help to design the services. Of course, the center of the care is patient and their demands and features. And a reliable, successful wound management model starts with identification of patient needs and empowering patients with knowledge and supporting and including them in care process is the most important stage. And whole process must be well defined, as I mentioned earlier, in order to prevent communication errors and problems and confusion. And while members of the wound care team can be performed according to the patient condition, studies have suggested that the most important member of the team is the nursing discipline with various specialties, different specialties. Specifically, wound care nurses has a key role in these studies. And different countries define this special nursing branch with various descriptions, such as wound ostomy continence nurse in US, tissue viability nurse in UK hospital, and stoma and wound care nurse is used in different countries. For example, in Turkey, we are using the stoma and wound care nurse term. And in my country, wound care nurses have Ministry of Health approved their certification after about 1.5 month training, including theoretical and clinical. And these nursing specialties foundations were laid with Florence Nightingale during the Crimean War, which was also the milestone of modern nursing. And Florence Nightingale's work particularly crucial in terms of drawing attention to the importance of prevention, observation, and data analysis. And in line with today's healthcare needs, a stoma and wound care nurse is defined as a certified nurse who has graduated with a bachelor's degree in nursing, has completed a globally accredited training program or a training program recognized by their national professional organization or governments, and have the necessary competence in the care of individuals with wounds, ostomy, and incontinence problems. And every nation's certification criteria may vary depending on focus or scope of the expectation from this nursing specialty. And this definition also implies a
Excuse me, Dr. Hildan, 3 minutes left.
Yes.
Yeah.
Okay, I'm finishing. Thank you. This definition implies a comprehensive job description and expertise with a professional vision. Its vision comprises providing person-centered, evidence-based, holistic care with continuous development, integrity, and collaboration. And their roles and responsibilities consist of training and counseling, health promotion and maintenance, leadership, advocacy of the patient and profession, quality improvement study, resource management, determination and implementation of health policies, also leading the health policies. A wound care nurse must be competent about pathophysiology knowledge, prevention and treatment of disease, person-centered holistic care, comprehensive patient assessment, evidence-based practices, quality improvement again, patient safety, communication and teamwork, research and analysis methods. And every wound care nurse must improve themselves according to these competency criteria. They must have specialized training and certification, clinical experience, and critical thinking skills, and they follow ethical principles. They believe in importance of trustworthiness and continuous professional development. Today's world requires establishing creating an innovative culture, leading and managing change, ability to exceed limits, risk management, transforms challenges into opportunities, are expected from this unique nursing specialty. Today's world required these expectations. That's why we need to believe in continuous improvement. Let's look at the literature regarding this presentation's focus. This is a systematic review study, examines 19 publications without year limitation on the impact of multidisciplinary teams in the management of individuals with diabetic foot ulcers. The study reports that a multidisciplinary team consists of consultants from different branches, specialist nurse, podiatrist, and orthopedic specialist. Positive effect of this team on amputation rate, severity and amputation, and resource utilization. Contribution to improving quality of life and reducing mortality. That means multidisciplinary care teams affects the wound healing in positive way. In this review study, 988 articles were examined between the years 1998 and 2018, aiming to understand nurses' role in skin and wound care research. The study found that overall proportion of nurse-led articles is almost 30%. Total number of articles increased over time by nurse-led contributions, and nurse-led research was strongest in the design categories, cohort studies, systematic reviews, and critically appraised literature and evidence-based guideline. And result of this review indicate to us, in addition to crucial clinical roles of this special nursing branch and nurses also have a substantial impact on academia and the development of evidence-based knowledge to guide clinical practice and role modeling to other professions. Thanks for listening me. Thanks for your attention.
Okay,
This is
give
my
applause
presentation.
for Dr. Chakar. Thank you very much for all the speakers for giving us a new insight in wound care management. Now we move to the question and answer sessions. I'd like to have 3 questions from the participant, both in this room and in virtual room. So, any question from the participant? We have we provide 3 questions from this room and virtual room. Any question? Yeah. Okay. Please have the microphone.
Okay. Good
Yeah.
morning.
Before your say your question, please mention your name, mention your institution, and to whom your question is directed.
Okay, thank you. Thank you for the greatest presentation, Prof. I'm Rizka Levia as a nurse student from Universitas Nasional. I have 2 short questions. The first, as we know, if we carry out as policy, we involve many people. The first question is, how the Malaysia healthcare to encourage the patients, caregiver, family members, until it can be empowered wound care and dressing change. And the second is, are there any limitation to robot wound treating patient wound? Thank you.
Okay, thank you, Sylvia. So I think I cannot repeat again the question. Yeah, you can answer directly. Sylvia Saputri about the Rizka.
Rizka.
Oh, Rizka.
Rizka.
You got the answer? You got the point? You get the point?
No.
No. Okay.
I didn't get the point.
Yeah,
Never
yeah.
mind.
Sorry. Okay. You can repeat again the question. Sorry.
Maybe because of the sound,
Yeah, okay.
not very clear.
Yeah, the sound is.
Or maybe you can
not good.
write, you send to us.
I think you can ask in short word. Yeah.
Okay, thank you, Prof, for the time for the creative presentation. Two short question is how to Malaysia healthcare to encourage the patients, caregiver, family members until it can be empowered wound care and dressing change. And the second is, are there any limitation to robot wound treating patient wound care? Thank you.
I think about the Malaysian people, how to encourage to wound care, something like that. Rizka?
And correct the family, patient, caregiver as your presentation before.
Okay, encourage the Malaysian people to, to take care.
Yeah,
take
their
care.
family, like healthcare, health education or health coaching to family members or something.
To family member.
All right. So you are talking about how to educate the patient and patient caregiver. We are not talking about the healthcare providers. We are talking about the patient care provider. That means they are family members, all right? So, of course, I think in Malaysia, we do have a few categories of patient. The patient who have compliance to the medication, the compliance to all the lifestyles, and those people who are not compliant. So in order for us, I think I better stand. I'm so used to stand. Okay, in many countries, not only in Malaysia or Indonesia, we have different categories of patients. Sorry, I'm so used with that. The Saudis, sah means, okay, right. Okay, first, the patient who will listen to your advice, correct? And then those patients who will not listen to your advice. But remember, it doesn't mean that those people who are poor only did not listen to your advice, correct or not? Those people who are educated and those people who are plenty of money also, sometimes they do not follow your advice, correct or not? Yeah. All right. Why they behave like that? Can we change people's behavior overnight? No. So what are we going to do? We have to consistently provide the information in a way with our evidence base. You know what is evidence base? We have to tell them, if you did not, because very simple, if you look at people who are smoking, you think that they don't know that smoking can cause lung cancer? They know. You think that some of those doctors not smoking? No. So can we change everybody 100%? No. So the thing is that as the healthcare providers, we have to provide them with all the information, all right? And the current information on the treatment and what will be the alternative for them to follow you, all right? For example, if you want them to go for the treatment of that wound, first of all, you have to educate them. That to say that wound care is very important. If you don't go for the wound care, you're going to lose your leg or you're going to lose your... If you say that you're going to lose your leg, does that affect them? No. If you say that if you lose your leg, your dignity will be reduced, you think it will strike their mind? Dia punya personality akan hilang. Dia punya kehandsomennya pun akan hilang. You think that will be more effective rather than you say that nanti kakinya hilang? Yang mana lebih bagus? When it touch with their personalities, definitely it will provide them with more impact on how to change their behavior. Number two,
We are talking about the patient. Number two, we are talking about the care provider. Remember, tadi itu bakal Pak Menteri itu kata apa? Kalau daripada Universiti Indonesia, perawatnya semua bagus-bagus ya? Bagus. Kalau bagus-bagus, patient akan datang atau tidak? Yes. So, the treatment that they're going to receive. Correct? So, if you provide a good assessment, this is where I said assessment is very important. Not only the assessment of the wound, but the assessment of the patient itself. If you see that the patient is very aggressive, so are you going to behave as aggressive as the patient? No. You have to answer them in a way that they will be attracted to come again. That is assessment. Number two, you're going to assess on the wound itself. If you provide a very good quality of care, people will still complain, but people will always respect the best care that they will give. That is one of the attraction for the patients to come to you again. Remember, in some countries, they call it a magnetic hospital. You know magnetic hospital? I'm sure some of the hospitals, especially the private hospitals, they already started with that. If you give a best care, very good quality, 9.9% good quality, the patient will come. So the strategies will be the same. So I hope that will answer your question. All right?
Okay. Rizka, you got the answer?
All
Yeah.
right.
Okay, thank you very much for the answer from Farida. So any question again from this room? Okay. Please stand up and mention your name, your institution, and your question is directed to whom?
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Thank you very much. Good morning before lunch, and thank you for greatest presentation to Prof. Dr. Faridah Muhammad Said. And my name is Rini Kadarwati from Fikes UNAS, Master of Midwifery, second semester. I want to ask about complementary therapy, wound care with honey. And what kind of honey that we can use, that we have find, because in money market, honey is a lot of sugar, Prof. And I mean how different it. And second question is what kind of one that we can use honey is a complementary therapy. Yeah. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum. Okay, thank you for the question. So you are asking me about the honey, the use of honey in terms of wound care. I think the best person to answer is the dean. I will not answer that because the best person to answer is because I think you have done a lot of research on that. So the best person to answer the question is your dean. But anyway, I'm talking in terms of the Malaysian perspective. In Malaysia, the use of honey is very, very, very limited because even we do not encourage people to take honey as how they wish, because you know some of the honey in the market is not the pure honey. It is also added with sugar. So they will increase, if they are diabetes, it will increase on diabetes. So honestly, we do not use honey for all those complicated wound. Normally, they encourage all those, the well-documented, well-approved honey to be used only on a very superficial use of a wound, you know. We don't use any of those secondary wound patient. So that is what I can answer. I don't want to answer because after that, she will not invite me again here.
Thank you very much, Prof. Farida, for the answer. Rini, you got the answer, yeah? Okay. Now, from the virtual room, is there any question? Yeah? With the raised hand? Sylvia. Okay. Irma. Irma, can you hear me? Would you say something for the question? To whom your
Okay.
question is directed? Yeah.
Okay. Assalamualaikum warahmatullahi wabarakatuh. My name is Irma Sofa from Midwifery Program, Universitas Nasional. Thank you for giving me a chance to give the question in this conference. I'm sorry for not being present on camera, but I'm excited to listening this presentation. I want to ask Professor Dr. Vildan Chakar, PhD. Merhaba, Professor. There are six.
Merhaba Irma.
Merhaba. Benin Adam Irma.
Irma.
Nice, Turkish language,
Yeah.
yeah.
Jadi
Irma.
There are 6 components wound care. The first is safe, effective, patient-centered, timely, efficient, and equitable. That you can you explain this component in wound care from delivery woman? Thank you.
Okay, Dr.
Thank you.
Chakar.
Thank you, Irma, for your question. As you know, these components are also criteria for patient-centered care. And World Health Organization defined the criteria for the effective person-centered care, which are, as you said, as you repeated, timely, efficient, fair, equitable, and these criteria are guarantee of any patient-centered care activity. And if you follow the evidence-based guideline, evidence-based information for our wound care practices in our daily practice, as nurses, we will be providing person-centered care. And also, we can provide this person-centered care by empowering and including the patient and putting them in center of the care. And also, we should not be alone during our activities. What I mean, our institution, our governmental organizations must be support us by legislation, by regulating the processes, by auditing us, by empowering us as a professional. Thanks to that activities we can provide only. Otherwise, these components will be weak and will not be realized. I hope this can be an answer to you.
Hello,
Thank
Irma.
you. Yes?
You get the point?
Yes, I got a point.
Okay, nice.
Thank you.
Thank you.
Okay.
Thank you,
This
Dr.
is not
Chakar.
only one person business. Everyone must be involved. Otherwise, we can't mention about teamwork and efficient wound care, person-centered wound care.
Okay, thank you, Dr. Vildan. The keyword is the 6th component is for the patient health center. Yeah, I think so. Okay. So because of the limitation of the time, now we finally come to the end of the seminar. Before I close the seminar, I'd like to take the conclusion from what the speaker has been presented. The first, allow me to read, yeah. The first, the assessment and documentation care is important, basic, before conducting the wound care management. The second one is, there have been proven that the implementation of modern wound care make patient more comfort and more benefits to accelerate wound healing. And the third, also, nurses should improve and develop digital wound management by conducting research in the future. Teamwork or multidisciplinary management are needed to improve wound healing rather than individual management. Multidisciplinary teams consist of specialist nurses, podiatric, and orthotic specialists. And the last one is, in addition, a lot of studies reported that multidisciplinary approach improve quality of life and reduce mortality in diabetes foot ulcer. That's it, the conclusion about the seminar today. So I'd like to thank the speakers for the informative and interesting presentation and all the participants who joined in this conference. Once again, thank you very much, Prof. Farida, and thank you very much for Dr. Phil Dan Cakar.
Thank you very much to you, Dr. Hisni and organizing committee.
Okay, thank you very much. You're welcome. Have a nice day. Yeah.
Thank you.
The time is back to MC. Yeah.
Let's give a warm applause for our speaker and moderator for this first conference session.
To our speakers and moderator, please stay on the stage because we will give token appreciation and we invite Ibu Nurse Naziah, Master of Nursing, to give token appreciation to our speakers and moderator.
Thank you so much.
Once again, we would like to thank you to moderator and the speakers for a very useful discussion. Next is the delivery of the material for the second international seminar session, which we will hand over to Ibu Nurse Intan Asri Nurani, SP Kepkom, as the moderator.
Professional Nursing Education Study Program, Universitas Nasional. Her education background is community nurse specialist from Faculty of Nursing, Universitas Indonesia. She is a doctoral student at Faculty of Nursing, Universitas Indonesia.
Kepada Ibu Nurse Intan Asri Nurani, kami persilahkan.
Okay, thank you for our beautiful Master of Ceremony of today. Assalamualaikum warahmatullahi wabarakatuh. Yeah, let me introduce myself again. My name is Intan Asri Nurani, and I will be your moderator for this second session of today's event. But before we start the event, I would like to read all of the speakers' curriculum vitae. Please, slide. The first speaker is our Dean of the Faculty of Health Sciences, Universitas Nasional, Professor Dr. Retno Widowati, Master of Science. She is a Dean of our faculty, of course, and she finished her education at Institut Teknologi Bandung for Magister and Bachelor, and at Universitas Indonesia for her doctoral education. And also, she has a fabulous history of work and also organization. And our second speaker is Mrs. Maria Elizabeth Cornell Bawa, RN, RM, and SN, DNE, DNS, from St. Paul University, Philippines. Can already in Zoom, right? And Mrs. Elizabeth Cornell is graduate from the PhD program on the St. Paul University, Philippines, and also she is a dean from School of Nursing in the St. Paul University. And the third speaker is Associate Professor Dr. Sophan Chunwan.
Yeah, good morning. I'm here.
Hi, good morning.
Hi, good morning.
Yeah, nice to meet you today. I will read your CV first. Okay, this is the CV of Mrs. Professor Dr. Sophan Chunwan from Prince of Songkla University, Thailand. Okay, and her academic background is Bachelor of Nursing and Midwifery from the Faculty of Nursing, Prince of Songkla University. And can we move the slide? Okay, and the last academic background is PhD from College of Nursing, University of Kentucky, USA. Very nice to have our three speakers today, and also we already have our on-site speaker for Professor Dr. Retno Widowati. I'm inviting you to come to the stage. And I would like to say hi again for Miss Maria Elizabeth Cornell, already in Zoom. Okay. And also Associate Professor Dr. Sophan Chunwan. Okay, nice. Okay, then we will have three topics of this second session. The first one will be presented by Professor Dr. Retno Widowati, Master of Science. And her topic is the efficacy of honey as a topical agent for wound healing. For the second and the third speaker, we will wait until the first speaker to finish the presentation. Then we will move to the second and the third speaker. For Professor Dr. Retno Widowati, Master of Science, the time is yours.
Thank you very much. Good afternoon, ladies and gentlemen. Thank you for the opportunity to me and the committee invite me to be invited speaker for Seminars International today. Next, please. The slide. Okay, next. Yes, this is my presentation title, The Efficacy of Honey as a Topical Agent for Wound Healing. You know that Professor Farida gave introduction about the honey become agent for the wound healing, and I know that Miss Rini maybe wait for my answer with your question. Okay, next. Okay, this is the background. You know, this honey is natural products with rich history, has been used for centuries to treat various ailments and including the wounds. Its effective as topical agent for wound care can be traced back to ancient civilization. Please next. This is the ancient civilization and honey. For the ancient period, ancient Egypt, honey was applied to wounds to prevent infection and promote healing. And then when the period of the ancient Greece, Prof. Farida said that Hippocrates, the father of medicine, he prescribed honey for a variety of conditions, including wound care, skin infection, and digestive problem. And when the ancient Rome, honey was used to clean wounds, reduce inflammation, and accelerated healing. How about the modern era and scientific validation? Please next. Okay. Honey was used traditional medicine, but after advanced the modern medicine like antibiotics, it has experienced resurgence in recent decades. And then the rising global antibiotics and resistance has forced development the novel therapies and alternative to combat infection. But we know that we have antibiotic resistance, and we come again to honey become the modern dressing because they confirm that the honey have antimicrobial, anti-inflammatory, and wound healing properties of honey. Okay, next. So what's the mechanism of action of honey in wound healing? They have a minimal 5 mechanisms like antimicrobial activity and then anti-inflammatory activity, promotion of tissue repair, this is very important, and then debridement and pain relief. Okay, next. So, what is honey? Honey is a sweet viscous substance produced by bees from nectar of flower or, yes, this is very important, nectar or exudate of the plant, not all of honey from the flower. And bees collect the nectar, store in the honey stomach, and transport back to in the hive. And in the hive, the bees process the nectar by adding enzymes and dehydrating it and turning become honey. And then next, what's the physicochemical properties of honey? So honey have complex mixture of the component, but the main content of honey must be sugar. So every honey must be main content by sugar. Yeah, but primarily they have fructose and glucose, and many enzymes such as invertase, diastase, and glucose oxidase. That enzyme play a role
in the breakdown of complex of sugars and production one important compound, that hydrogen peroxide. And another's, please, next. Yeah, this is just only tell to you that's how come the hydrogen peroxide can break down from the glucose, because the glucose is the main sugar from the honey, and because the glucose oxides become gluconic acid that give the acidity of honey, and of course the hydrogen peroxides. Okay, next. And the small, for the properties of honey, they have small of amino acid, vitamin, mineral, and of course one's important is antioxidant. And the flavor of and the color of honey depend on the type of flower or plant which the nectar is collected. Next. Now we focus about the research acacia honey as topical agent for wound healing. Yeah, why acacia honey? Yeah. Acacia honey production in Indonesia has increased rapidly in recent years, and price become uneconomical for honey beekeepers. Why? Because we know on Sumatra Island, Jambi, province Jambi, and then Riau, and then South Sumatra have Asia crassicarpa industrial plantation forest that's become industry for the like paper, paper. And Acacia crassicarpa is very special because the honey, the nectar, not from flower, but from the exudate of the tip of the tree of the plant. We know that is the picture, and the sign is how the hive of the bees next to the Acacia crassicarpa plantation. Now, another one, why acacia honey? Because the research of acacia honey is still rare, and if we do integrated research on acacia honey, are expected to increase useful and selling value of acacia honey. What's the characteristic of acacia honey? So they have reddish-brown color, acidity between 3 until 4, high antioxidant content, and have some of enzymatic antioxidant, and have non-enzymatic antioxidant are secondary metabolites compounds like ascorbic acid, phenolic compound, flavonoid compound, phenolic acid compound, carotenoid derivatives, and organic acid. Now we learn more about the acacia honey research for wound healing. I have 3 titles for the acacia honey research for wound healing. First, acacia healing for healing perennial wounds. The second, acacia honey for wound care post-sexual cesarea. And the third, acacia honey as a primary dressing on diabetic wound healing. And of course, the research objective is to investigate the effectiveness of acacia honey as wound healing agent in midwifery and nursing care. Okay, this is just only information how about the wound healing process. So from the hemostasis, inflammation, that's clearing the debris, proliferation, building the new tissue, and remodeling means strengthening and maturing the tissue. Okay, next. Okay, and how to evaluate the wound condition? We can use radar That means redness, edema, ecchymosis, bruising, discharge, and approximation. And then, more, next. We can use Bates-Janssen Wound Assessment Tool, or BWAT. They have consist of 13 wound characteristics. And then, next. And another one is modification from BWAT, and we say that Wiener scale, because they're simple, just only consistent assessment, including wound area, wound states, wound edges, undermining, skin color around the wound, edema, granulation, epithelialization, type and amount of exudate. Now, yes, this is the first acacia honey for healing perineal wounds. We know that perineal rupture of is still in the perineal tissue that occurs during vaginal delivery. Perineal tears occur spontaneous or using tool or action. Inadequate care can lead the infection, which hinder the healing process of the perineal wounds. And you know that if we use pharmacological therapy like, with antibiotic and antiseptic, like iodine, can be admit, but the drugs have side effects like allergies on inhibition of collagen growth. Okay, and then this is the resume of our research. We use 5 milliliter honey on sterile gauze and compress the perineal wounds area for 1 until 2 hours with duration for 7 days, twice a day in the morning and the night at the same time. And we assist the patient do not to urinate or defecate for at least 2 hours because we need the honey contact with the perineum. And how about the result? This is the result. And the conclusion of our research is honey compress improve significantly perineal wounds healing rate in postpartum women group compared to control group without honey compress in the same period. This is the picture about how if honey give for the compress of the perineal and become very dry, and we say that's a good condition, not like 7 days before. And then, please, more next, yeah. And the second, we try honey, acacia honey for the wound care post-sexual cesarea. We know there's an incision about 15 centimeters, yeah, and we say that uterus is open, and the second incision to the uterus, and after that, slit close, yeah. And then, this is the resume of our research. So, we give the honey is after the first replace the dressing, the first research, so that after on the third days, yeah, was cleaning according with HOP, and the reader was score. The reader score is measured and rub the 5 milliliters of honey, and then after 7th day, after the day of 7, the patient come again to the clinic, and then we see that how about the development of heel. Okay, please. So this is so simple. You give the honey, acacia honey, to the incision, and then close with sterile gauze and plaster. And you see that after, in the 7 days, the wounds is become healed. Okay, and then this is for the result. So the conclusion, honey ropes improve in significantly resection cesarea wound healing rate in postpartum woman group compared to without honey rubber group in the same period. And this is some photo. This is with intervention and the control on the 3rd day and the 7th day. And the next, this is the 3rd. We know that the most common wound in patients with diabetes mellitus is diabetic ulcers. And next, yeah, this is the resume of the 3rd research. Okay, we have 20 patients with diabetic wound from grade 1 to grade 5 with moderate and to abundant exudate. Okay, and we say that how about after 14 days? Yeah, this so simple, but for the patient we give the acacia ane until for 1 month. Okay, next. This is the result. So we say that p-value is significant before we give the honey dressing and after that. This is a picture. Yes, next. Before and after, after initial wound and the wound after acacia honey primary dressing, we say that can be seen that the necrotic tissue has dispersed. So, and the patient will be give until become healing the wounds. So, next.
Sorry, Professor, your time is still 2 minutes more.
How does acacia honey heal wounds? Because they have, yes, next. They have biological properties and therapeutic activities honey in wound healing. This is summary in the right picture. They have antimicrobial with effective factors like hydrogen peroxide, high osmolarity, acidity, antioxidant, and increased lymphatic phagocytic activity and nitrate oxides. And the action for the antimicrobial inhibit fungal and then bacterial and of course the viral infection. And they have anti-inflammatory activity with effective factor like lymphocyte, phenolic component, because they can reduce edema and pain, minimal hypertrophic, and then stimulate granulation and epithelialization, improve oxygenation, and prevent necrosis. For the antioxidant activity, effective factor is flavonoid and phenolic acid with action inhibit TNF-alpha induced cytotoxicity, decrease of number of inflammatory cells, and stimulate B and T lymphocyte. And for the debridement action, effective factor is provide environment and protease activity. They can action remove the dead contaminant tissue, remove necrotic material, and contributing to painless lifting of slow. And the next, stimulation of tissue growth is very important because the stimulation of angiogenesis supply glucose to provide energy and migration cell. And the last but not least, boosting to the immune system because they have effective factor like macrophages, leukocytes, and prebiotic. Okay, and okay.
Professor, sorry,
Yes.
your time is up.
I think the last, I want to would like to thank then many contribution in this research to Dr. Bidan Lisa Trina Alim, Ms. Risa Kolinisa, Dr. Rizky Hidayat, Ms. Yani Suryani, Ms. Yani Antiani, Ms. Ayu Aryani, and Ms. Sylvia Amanda Putri. Thank you very much. This is my presentation.
Please give a big applause for Professor Retno Widowati for his fabulous presentation. Thank you, Professor. And we will go to the next speaker. I would like to invite again Ms. Maria Elizabeth Cornell Bawa.
Yes.
Do you hear me,
Good
Professor?
afternoon, everyone.
Good
Yeah.
afternoon, Professor.
Yeah, good afternoon.
Yeah, we hope you are in
Okay.
a good situation.
Yeah, yeah. We had a typhoon here in Tugigaram.
Oh,
Yeah.
yeah, we have you all in a good situation and condition, and we will start your presentation. For the theme is caring and professionalism in nursing service in era of digitalization 5.0, and your time is about 15 until 20 minutes. Is it okay for you?
Yeah, yeah. Okay, can I share my slides?
Yes, yes, you can. You can start to share your screen.
Okay. Thank you. Can you see the slides now?
Not yet, Prof.
Oh, where? Where is it? Okay, may I share my slides? Oh, I don't know why. Okay, so maybe I will allow the
Okay, can we help
organizing.
you to
Yeah,
share
you
your
can
slide?
share my slides.
Okay, please slide from Professor Elizabeth.
Okay, so thank you. Can you hear me clearly?
Yes, clear, Professor. You can start your
Okay.
presentation.
So so thank you so much for your kind invitation. The topic that I would like to share is caring and professionalism of nursing services in the era of digitalization 5.0. I am Dr. Maria Elizabeth Bawa from St. Paul University, Philippines, and I am in charge of the Master of Science in Nursing and Doctor of Philosophy in Nursing Science. So next slide, please. So the topics that I would like to share this afternoon is some concepts about caring in nursing, the theoretical and philosophical frameworks, like the theory of human caring by Dr. Jane Watson. And of course, I would like to share as well the professional values that we would like to embrace in nursing. And lastly, the caring or cyber caring in the digital world by Gene Watson and Sitzman in 2016. Next slide. Okay, so for a brief background of my presentation, as nurses, we know that the dynamic essence of nursing is because of caring. So caring is regarded as the motivating factor that guides our nursing action. Watson also espoused that caring is the moral ideal of nursing. It is regarded as the core value that we embrace in nursing. And then Roach also mentioned that caring is the human mode of being. So nurses are expected to demonstrate caring behaviors as they care for their patients. And as we provide quality caring, we also extend therapeutic effectiveness, especially in wound care management. And these are provided by nurses, no? Because they would like to positively affect patients' healing. And then providing quality caring means exceeding the quality of care that our patient needs. Healthcare quality is also a degree in which healthcare nursing services increase the likelihood of improved patient care outcomes, according to Duffy. And then the way nurses care for patient is very critical to improve patient care outcomes, especially in wound care management. Next slide. So in the rise of the internet and in the advent of digitalization 5.0, we are confronted with a lot of ways or new ways in which to deliver care. So we have electronic means not to use in order for us to provide new ways of caring in the digital world. So that's why I would like to introduce the theory of human caring by Gene Watson, because this is a philosophical and theoretical framework that we can utilize in this digital world of 5.0. And so that we can provide the necessary care in the ongoing change of advanced technologies in the healthcare system. Next slide. So that's why the caring science and the 10 Caritas processes are very important frameworks that nurses and midwives can use. So the caring science and the 10 Caritas processes will help us establish and nourish an intent to consistently care and engage in caring practices, whether we are in the digital world. So whether we face digitalization and advanced technologies in healthcare. So the digital era is the current time when digital technologies are widely used. So the most important question that we can ask is, do nurses lose their caring behaviors in the use of digital technologies, such as computers, internets, mobile phones, cloud computing, and other technological devices? Next slide, please. So that's why I would like to introduce Watson's caring science. So this demonstrates, or if you are familiar with the Watson's Caring Science Institute, we can learn how nurses should conduct themselves professionally towards their patient while developing virtual relationships. So this particular concept or new field of endeavor describes how caring and love can transcend distance, space, and time in our increasingly virtual world to preserve the very basic concept of caring, of humanity. And as we physically interact less and electronically interact more with our patients. Next slide. So that's why I would like to introduce, and maybe you can get a copy of the book of Gene Watson and Sitzman on caring in the digital world. So this particular textbook would provide examples of initiatives aimed at establishing ongoing intent to care on levels ranging from personal to global. So it includes a variety of educational activities that rely on digital resources to facilitate interaction, collaboration, learning, and connection. The learning objectives and knowledge check questions in each chapter of the book reinforce information and a corresponding massive open online courses and other free professional online trainings that are available to readers to augment their study. Next slide. So this is Dr. Gene Watson, and I would like to introduce the theory of human caring by Watson. Next slide. So this is her theory. So we can utilize, no, nurses and midwives and other healthcare professionals can utilize the theory as basis or framework for nursing practice. So in this particular theory, Jean Watson explained that caring among humans, we cannot treat them as objects of care, and humans cannot be separated from the self, from others, from nature, and other large workforce. So this theory encompasses the whole world of nursing with emphasis on the interpersonal process between the nurse or the caregiver and the care recipient. This theory focused on the centrality of human caring, that there is a caring to caring transpersonal relationship and its healing potential for both the one who is caring and the one who is being cared for. Next slide, please. So further, Jean Watson also said in the theory that we can utilize this particular theory of human caring for as basis or foundation for nursing practice. So she said that caring begins with being present, open to compassion and mercy, being gentle, loving kindness, and equanimity towards and with the self and others, which one can offer compassionate caring to each other. So the Watson's philosophy and science of caring is concerned on how nurses express care to their patients. And the theory stresses humanistic aspects of nursing as they're intertwined with scientific knowledge and nursing practice. Next slide, please. So in this theory, I would also like to emphasize the transpersonal caring relationship that happens between the nurse and the patient. So nursing is concerned with promoting health and preventing illness and caring for the sick in order to restore health. So according to Watson, caring is considered as central to nursing practice, and it promotes health better than a simple medical cure. Next slide, please. So in the world of digital technologies in healthcare, the landscape of nursing seems to be responding to the various demands of machinery with less consideration of the needs of the person who is attached to the machine. So that's why the theory of Dr. Rosano Locsin, technological competency, caring in nursing, can be a very valuable framework that we can use while we use digital technologies in healthcare. So the emphasis of the theory is that the disease might be cured, but illness would remain because there is no caring and health is not attained. As I've said, caring is the essence of nursing, and it connotes responsiveness between the nurse and the person, and the nurse co-participate in the care of the person. Next slide, please. So assumptions of this theory: caring can be effectively demonstrated and practiced only interpersonally. Caring consists of curative factors that result in the satisfaction of certain human needs. Effective caring promotes health and of the individual and family. Caring responses accept the patient as he is, as well as what he or she may become. And there is a need for a caring environment in order to develop the potential for allowing the patient to choose the best action for themselves at a given point of time. The science of caring is complementary to the science of curing. So we can blend them together. And the practice of caring is again central to nursing profession and discipline. Next slide. So these are the 10 Caritas processes. So we embrace altruistic values and practice. So we inspire faith and hope and honor others. We trust, we nurture, we forgive, we deepen scientific problem-solving methods for caring decision-making. We observe balance in teaching and learning. There is co-creation and co-participation between the nurse and the patient. And we would like to minister basic emotional and spiritual human needs like complementary alternative medicine. And we are open to mystery and allow miracles to happen. Next slide. So let's go to the professionalism in nursing. So why professionalism in nursing? So professionalism in nursing means providing top quality care to patients while upholding the values of accountability, respect, and integrity. The primary reason why we have to be professional in our acts and in our behavior, as well as in collaborating with others, is for us to promote patient safety. Healthcare is delivered in teams, no? As mentioned by the previous speakers, and we cannot provide optimum patient care if we don't work in teams. And as we work in teams, we respect the principles of honesty, respect for others, confidentiality, and responsibility of our actions. Next slide, please. So these are the basic foundations of professionalism in nursing. First, we have knowledge or cognitive. So we teach knowledge and information to our students. We also develop the attitudinal behavior and attitudes of our students. So we teach them professionalism. We would like them to embrace professional values and ideas to guide their nursing practice. Next slide. The last is psychomotor or the skills. So we teach them nursing procedures, nursing skills so that they gain the experience and develop their potentials in building their clinical skills. So nurses has to act professionally, and this can happen if they sharpen their management skills and they better understand the obligations and commitments that are involved in the practice of nursing. Next slide. So the real world of application of nursing professionalism. So the first is caring. So caring communication is key. So we listen to others. We provide information and advice clearly so that our patients can understand. And we make well-informed decisions that are best for our patients. We respect the dignity of our patients. That's why we protect their privacy. So we never give up information if we are unauthorized to provide the information so that we can preserve confidentiality and anonymity when citing patient cases in research and other sharing public documents. Next slide.
Sorry, Professor, your time is about 5 minutes.
Okay, so let me just finish. This is a few slides left. So there are 6 core values of nursing as professionals. We have empathy, professionalism. Next slide. Autonomy, and next slide, altruism and accountability and curiosity. Next slide, please. So for the application of exercising professionalism, so I encourage everyone to work together to maintain high standards of care, to be honest and exercise integrity. And of course, let us uphold reputation. Let us aware of the consequences of our action, even outside of work. Next slide. So caring in the digital world by Watson and Sitzman. So caring is when the one caring connects with the other and embrace the spirit of the other person through authentic, full attention in the here and now. And Caring conveys a concern of the inner life and the personal meaning of the other person. So as we practice caring in the nursing profession and other caring profession, we must practice timeless ethic of caring and an honoring of the centrality of caring, healing relationships. Next slide, please. So these are the basic assumptions of caring in the digital world. So nursing, being a caring profession, has the ability to sustain its caring ideals, its ethics and philosophy for professional practice. Our humanity is aimed to survive, and we are to evolve towards a more loving, caring, and deeply human and humane environment, moral community, and civilization. So we must sustain love and caring in our lives, in our work, and in our world. Next slide. So that's why we have to exercise caritas consciousness and cyber caring. So according to Watson, at this point in human history, we are awakened to a reality that each person on planet Earth is part of a vast invisible veil and web with all of humanity and the environment. These advanced innovations are non-linear, quantum jumps towards activation of social and human potentials for us to achieve a universal humanity. And further, we are faced with a quantum leap of human consciousness from physical to non-physical, from matter to spirit. So let us exercise cyber caring. So I know you are familiar with this. So let's respect one another while we use human technological challenges that we face. And let us apply the philosophical and theoretical frameworks that I have explained earlier. Next slide. And let's exercise caring consciousness. So let's be conscious of the evolution of technology as we enter in this new worldview. So this is vital to ethical evolution and education. And I think if we exercise caring consciousness and cyber caring, this will guide us in our decisions in the near future. Next slide. Okay, so I think I have explained caring in the digital world and cyber caring. So let's learn this, no? Let us be together. Let us combine efforts. We are one world. There is what we call as universal humanity. And as we utilize digital technologies, let us not forget to become to exercise humane and professional values in our work and in the practice of our profession in nursing and midwifery. I think I'm finished with my presentation. So let us exercise cyber caring. Thank you.
Yeah, thank you, Professor Elizabeth, for your great presentation. And now we move to the third speakers. I would like to invite again Mrs. Sopan Chunuan.
Yes.
Yeah, do you hear me?
Good afternoon. Yeah.
Good afternoon. Okay, we hope you are in a good condition too.
Yeah.
Yeah.
I would like to share by myself for my PowerPoint.
Okay.
Can I do that now?
You can share it yourself.
Okay.
Okay. While Dr. Sopan Chunuan is preparing her presentation, she is from Prince of Songkla, University, Thailand, and her topic today is complementary therapies in my midwifery field. For Dr. Sopan Chunuan, the time is yours.
Yes, thank you very much. I'm very happy to be here today, and it's my honor to be guest speaker. And thank you for inviting me to talk in my area. So the topic of today, I will talk about complementary therapy in midwifery care. For my background, I work as a nurse, midwife in Thailand, because in Thailand we have nurse and midwife, but in Thailand, our education, we have both nurse and midwife together. So when I talk myself, sometimes I call myself nurse midwife. So now I am a chairman of the Master Nursing Science in midwifery, and I act as a head of department maternal and child and midwifery. I have 15 minutes, so sometimes I need to talk fast. So the outline, I will talk about definition, a little bit about complementary therapies and benefits, cultural and regional perspective, and research and evidence supporting complementary therapy, and how about guideline to implement this in our field. And I think this it is a challenge and have some limitation to if to apply this in our work, because we still work in hospital. For the definition of complementary therapy, many people or maybe students here or nurse can know already, like because it is like the complementary, like another care that we add with the regular care. So in in a Western country now, is it popular to use complementary? You know what? This complementary is used for 1,000 years, because many people in the past, we don't have like the high technology, but they use the herb or something. Now, the Western country interesting to use complementary therapy in their integrate with their care. So such as they use like acupuncture, massage, mindfulness, and a lot of people use herbal medicine. Why? Because they would like to enhance holistic care in for the physical comfort, or maybe for the psychological health, and they use with the conventional care. For the midwife, because we are our profession may be different from nurse. The midwife, we work, we provide care to the mother before they get pregnant, and then they get pregnancy, and during labor and postpartum. So our function, we can have independent role and we have dependent role together. So many CT, complementary therapy can be part of independent role in our practice. So the benefit of the complementary therapy in midwife care, normally, pregnant women have a lot of, a fear or a stress during their pregnancy. And when they go to the labor room, they have strong pain, and the pain cannot go, until they give birth. So we use complementary therapy for pain management. Some people use, during pregnancy, such as acupuncture or massage. Massage can use both, in pregnancy or during interpartum or postpartum. And we use complementary therapy during, labor to reduce anxiety, stress, and can use this to promote labor progression. And for the postpartum woman, we use some approach to promote recovery, such as we use herbal medicine, we use massage to promote healing, and we use massage to increase milk volume and to reduce base engorgement. So this is very important thing that many nurse, midwife can use complementary, is integrate with their regular care. So when we use this for the complementary, we need to concern about the culture, or maybe about some, value of the client. So for different country, they use, different technique. So I found from literature that for Asia people, for the country like China, Japan, they use traditional Chinese medicine. So they practice this like they perform a lot about acupuncture or herbal, remedies, and they really integrate into maternal care. And many use like the energy. So they have like the balance energy flow, they manage pain and some support postpartum for recovery and reflecting, they use like the woman center. and they try to bring their culture together. However, when we do this, we need to ask their permission until the benefit or maybe some barrier for complementary. And for Thailand, in Thai midwifery, normally after birth that we can use like the postpartum heat therapy. So in Thai word we call yu fai. So yu fai is mean they use the heat to make the mother feel warm, and then they can do like the for the breast milk. So the Thai massage maybe pass to add together with yu fai, so they can support recovery. They using steam and hormonal compression to promote uterine contraction and well-being. So this is common use in Thailand in the past, and now we have the advanced technique because we use it in the hospital. We invite traditional healthcare provider to be part of our care. And another thing that Thailand, because we are the Buddhists, so normally we use like the technique, like the meditation. We can use the traditional massage. We use Thai herb compress, during pregnancy and postpartum. And some hospital they use the herb compress during interpartum care. And they use eating herbal food such as the woman during during pregnancy or antenatal care. We encourage them to have like the ginger when they have like nausea or vomiting. So integrate some herb that not harmful to the mother and the baby. So this is very, very important thing. And in the past, in Thai culture, we use like the Lisi Dat Ton practicing. So we use in the past like the Asian people in the forest. So they sit many position. So we integrate and modify to use in our midwifery care in Thailand in some hospital. So I found that in Indonesia, jamu or Indonesia herb tonic, you use the herb same like us, right? For the Indonesian people. So the commonly used herb in postpartum recovery to enhance lactation. So same in Thailand. In Thailand, we use herb, to increase lactation for the mother who have some problem. And in India, they have many things. Same other country, they use herbal, they use oil massage to support the pregnancy and postpartum health. So in Western culture, I think for 30 years ago when I was in US, many people interesting to use complementary therapy to integrate. They use like the hypnobirthing. They use mindfulness to reduce anxiety and reduce stress and to help the mother, like adapt themselves to support their emotional. And I think for interesting, before we can use, some approach or some intervention, we need to prove by evidence base. So in here, in this topic, I will tell you about the research and evidence supporting complementary therapy. So many studies found that, acupuncture can reduce labor pain and duration of the labor. And aromatherapy, like we use lavender or maybe we use the peppermint to alleviate labor anxiety and pain. We use the massage therapy to to reduce back pain, to increase sometimes we don't want the mother have post pregnancy, prolonged pregnancy. So sometimes we teach them to breast massage or nipple massage, or sometimes we tell them to perform self massage during interpartum to increase breast milk. And for mindfulness, a lot of healthcare provider interesting did to use to decrease anxiety, to decrease depression symptoms during pregnancy, and sometimes we use to reduce fear during childbirth. And a lot of healthcare provider in Arab country use herbal medicine. So I think maybe in your country you can share later after we talk today. For the popular thing that my colleague and myself, we work together, we use yoga. Yoga is one population mind body medicine. We use, and recommend for the pregnant women use during pregnancy to help them to release back pain, and sometimes to help them because yoga integrate both position, and they control like the breathing together, so they can reduce anxiety. So in meta-analysis, they study in 31 study and about 862 subjects. We found that not it, we studied in 2,217 pregnant women, and we found that yoga intervention can reduce anxiety and reduce depression, and then they perceive stress, lower stress if they use yoga, because yoga is a body and mind, and they can control their mind, and they can have like the exercise, to help them to reduce some physical problem. So this evidence-based support that we can integrate yoga to our midwifery care. So here is another study for academic review. They found the effect of yoga on pregnancy. They found that in the RCT, they found that yoga can effectively reduce stress level and reduce anxiety score and depression score and pain response, because they can control themselves for well if they can use the breathing, control their breathing, so they can improve emotional well-being. And another one that yoga can use during labor. The effect of yoga practice, in labor pain from the systemic review, they found that in 9 studies, including 660 women, we found that they have like a significantly low labor pain if they use yoga. Why? Because the yoga can help the muscle strong, and they can use it during the labor, because labor, is filled with pain, it's filled with fear, and have a lot of tension. So when they can use their breathing or control their breathing, it can help to lower labor pain. It like, sometimes used automatically. And yoga intervention also reduce the intensity of labor pain in active and transition phase when compared to people who not use yoga. So this is very amazing thing that we do to integrate in our area. Another one that my colleague, she interested in Reiki. So Reiki is a Japanese in the energy healing practice that involves the transfer the universal energy from the practitioner to the client. So for myself, I cannot do by myself. I need to have someone help me to open like the chakra. And then we can do because it have many levels of healer. So I think for Reiki, for me, it's very difficult. But some of my master students, she learned about the Reiki, and then she used for her, conduct her study in her thesis. So the Reiki is, yes?
John Sopan, I'm sorry, your time is 1 minute left.
Okay, so Reiki is the energy healing practice. So here, for the picture here, so we can use Reiki in Thailand. And then, for another one that we popular user is a Maniwet practice. So it's the power of the position and breathing. And the key, successful of, for the Maniwet is it can help labor. It can use for labor management. It is culture significant. And here you see the position like the butterfly. And in the labor room, we can use this to reduce the duration of time. So Maniwet practice for my student, if you're interested, you can check from the, but it is in Thai. She used Maniwet to reduce pain and reduce the duration of labor. So this is a massage. My PhD student, she conduct the, like the traditional massage to reduce engorgement and improve breast milk volume. And this is many techniques that we use brain massage. Another one is aromatherapy. We can use this to reduce like the stress or depression. In Thai, we use mindfulness or in other countries is very important, to improve maternal fetal attachment, to reduce anxiety and depression and decrease perceived stress. Another student, she conduct like the meditation, then they can use, this. For my student is a Muslim student. She used like the listening to Honor Quran and psycholog to reduce stress. So this is very important thing. Another one that we use at KT, like the practice of positioning and breathing. So I think for the complementary, it is very important thing if we can integrate. My professor here, Satiton Pumduang, she used music therapy when she was study PhD, and now she still use this, and we integrate this in our. So I think for Kaila, it is very important to need to concern on complementary, some we need to practice. So we have the Center for Practice Student in our School of Nursing. So if someone interesting, you can come and practice with the professor here. We need to careful to use this, so it's challenging because if we write to use with standard, so we need to fill the gap. Many people need to understand how important or how benefit and what may be the barrier. So conclusion, complementary therapy can offer, is a valuable support in midwife, so it can make the mother have the, well-being. Okay, thank you very much. Sorry about that.
Okay, thank you Ajan Sopan. Actually, it's a very interesting topic about complementary therapy, but due to our time limit, we have to limit also the presentation.
Yes.
We can continue to the question and answer session. I'm inviting our three speakers of this second session of today's event. And also, is there any question from the participant on site? You can raise your hand.
I saw one light hand in the Zoom. Syria.
Oh yeah, from Zoom.
From Zoom.
Okay. You can unmute.
Yeah.
Okay.
Hello.
Yeah.
Thank you for the opportunity to given to me. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
I will introduce myself. My name is Sylvia. I have a master's degree in midwifery first semester. I want to ask Prof. Retno. Previously, I actually asked Professor Farida, but he answered about the use of honey for healing diabetes wounds. But there are still many who has not used this honey for healing wounds. What is the reason, Prof? Secondly, are there certain wound criteria that can only be healed by using this honey, Prof? The third, for Professor Sopan, how is the acceptance of complementary therapies in Thailand, Prof? In Indonesia, complementary is a tradition from ancestral times. So many people accept it and like complementary treatments such as like a massage after giving birth, herbal medicines like you say that's jamu in Indonesia, and how about the people on Thailand? What they accepted about the complementary therapies in this Thailand? Thank you.
Okay, thank you, Sylvia, for the questions. Maybe we go on first to Professor Retno. I want to read again the question. Maybe what is the reason that honey is not come from for the first place when nurse and midwife use for wound care treatment? And the second question is, what is the best treatment? What is the best wound care treatment from using honey? Is it perineal one or the cesarea or the ulcus for diabetic? Yeah, Professor Retno.
Thank you for the question. I try to answer your question, Miss Sylvia. Yes, until now, that's honey is not the first choice for the wound healing because this the choice from the patient and then from the doctor. You know that maybe in the modern period like now, people once go to the doctor and doctor don't know that honey is very have many characteristics to be a choice for the wound healing, and then honey, we know that they have hydrogen peroxide. That means if we didn't give the wound with the carefully honey with carefully, it's become like too much, and then become not can wound is not being well, but it's have like limited, I mean not good condition, and then we must know that the honey is pure, because you know there's not all of the honey is from the nectar from the pure honey from the flower or the plant, and we must know that the honey what have in the content, because you know that like I said the Manuka honey from New Zealand, they say that the one of the best for the wound care, but we want that Indonesia have a good honey who can become a reference honey to be a honey for the wound healing. And the second question is, what's the effective or the perennial or the for post-section or for the diabetic? Yeah, this is the choice of the patient, because until now many clinics give honey for compress, and they become the good healing for the perennial wound care, and then for the section, you see that the picture is real. They for the 7 days they become is very like very good become that healing, the healing. And how about the for the diabetic ulcer like that? Yeah, you know that if someone have not good condition for the ulcer, they must be patient to be good and have many time to go to become the heal condition.
So
I think it's
yeah,
enough.
so it depends on the wound condition also, yeah,
Yes,
Professor?
okay.
Okay, that's the answer from Professor Retno Widowati. Sylvia, is that clear? And next question is for Ajahn Sopan. Yeah. So the question is, what is the complementary therapies that most of pregnant or postpartum women choose in Thailand?
Okay, thank you for the question.
Yeah.
So normally in Thailand we have, like the IPE, so we have interprofessional care together. So in Thailand we have Thai, Thai traditional medicine. So we work together sometimes, and then we as a midwife sometimes we can do some procedure by ourselves by massage, but we need to learn from that or training from that first. So normally for the popular one, I think that they use herb because they can do by themselves. And another thing, for the massage. For the massage, sometimes, some people, they are aware of the, some problem. And they get the massage from like the traditional midwife in the rural area. We have some, midwife, some person can get care from our hospital, and then they can get care from the woman. It's not a still, training like the provide, giving care, but they can provide like the massage. They can do the, find the herb to provide to the mother in the rural area. But for the in the urban, now we have the traditional medicine hospital. And then for us, like the nurse midwife who work in ANC clinic and labor and postpartum, normally we use the massage, just a basic massage, or maybe we can use cold and warm compression and massage for to increase breast milk. And after birth, they go to their home. They can do like get the massage from many, healer that can be trained to provide. And then, I think it's it for me that you ask the popular one, maybe the massage and herb in our country, and music. Sometimes they use music at home, but we need to teach them. Yeah.
Okay, I think it's common in Indonesia too. There's herb and also massage is popular here, Ajan. Yeah. Okay, thank you, Ajan Sopan, and hopefully it will answer Sylvia questions. And maybe it's the last question from the audience here for our speakers. Yeah.
Hello, everyone. My name is Henry. I am a University Nasional student. According to Professor Elizabeth, she said that theory of Watson is better than another theories. As we know, many theories of caring. I mean, why is the mentioned theory is better from another theories? Thank you.
No,
Okay.
yeah, thank you for that question, Henry. I did not say that the theory of human caring is
I'm
better
sorry,
than-
Professor, your voice is very low.
Okay, okay.
Okay,
Is
it's
it
clear
better
now.
now?
Yeah, it's clear
okay.
now.
Yeah. Yeah, thank you for your question, Henry. I am not saying that the theory of human caring by Gene Watson is better than other theories, but I think the theory of human caring has already evolved. And from the theory of human caring, it has evolved into the philosophy and science of caring in nursing. So I think this is a more, this particular theory can be very useful for nurses who are practitioners, also for nurses who are in education and in nursing service. Now, this is only a theory that I would like to emphasize and stress in this particular topic, because I think it was Jane Watson who started, no? She started in the year 1985. The particular theory of human caring was first introduced to us. And from then on, Dr. Jean Watson has continued to evolve her theory. And later, she came up with the theory of transpersonal caring relationship, the theory of digital caring, and then, of course, now these are all based on the foundation of the theory of human caring by Dr. Jid Watson. But there are also other theories that we can utilize, no, in patient care or in nursing practice. There are a lot of nursing theories, caring theories that can be utilized. And we can also use, no, two or more theories, no, to ground our practice. We can use the theory of technological competency, caring in nursing by Dr. Rosano Locsin, and also the theory of human caring by Dr. Jean Watson. And then there are also other theories, no? Very valuable and very informative theories that we can use in nursing practice. So I would not say that there is a better theory, but all of these theories can be utilized and can be practiced by nurses. And I don't think there is one best theory but this. But I would like to stress only, no, because Jane Watson was the first to introduce the concepts and the dimensions of caring in nursing practice. I hope I answered your question.
Okay, thank you, Professor Elizabeth. So there are many theories, but you emphasize these theories for the digital world or cyber caring in nursing, right?
Yes.
Okay, thank you for your answer, and hopefully it will answer clearly for Henry as the audience that asking. Okay, actually, Professor Elizabeth, Professor Retno, and also Ajahn Sopan, there are still more questions, but our time are limited, so we have to finish this second session. And before I finish the session, okay, give a big applause for our three speakers in this second session. Thank you very much, so thank you very much. Okay. They are so enthusiastic to end this session. Before we end this session, I would like to emphasize our topic, three topics for today. The first one is honey scientifically approved in wound care treatment. Professor Retno told us about the effectivity of honey in perineal wound, sexual caesarea, and wound for diabetic ulcer because honey can transform glucose to hydrogen peroxide, so that honey could be antimicrobial, anti-inflammation, tissue repairment, and also pain relief. So honey can be our option to do a wound care treatment. And from Professor Elizabeth, what can I emphasize is in this 5.0 technology era, nurses cannot lose their sense of caring, right? And this utilized by Jane Watson theories from caring theory that could intertwine between technology and also nursing practice. So this is one of many theories that we can adapt to our nursing practice daily. Thank you for your insightful presentation, Professor Elizabeth. And also from Ajahn Sopan, we could see that complementary treatment are increasing globally, not only in Indonesia or in Thailand, but globally everywhere we can find any modern and traditional treatment complementary for that can be applied both in pregnant and postpartum women, but along with modern medication. Thank you very much for Ajahn Sopan also for your inspiring presentation. So we come to the end of this session. Again, thank you for Professor Retno Widowati, for Professor Elizabeth, and also Ajahn Sopan for having us in this event and give us a very inspiring presentation. So I would like to give the event back to the Master of Ceremony. Thank you. I'm Intana Srinani as your moderator today.
Okay, once again, let's give a warm applause to our speakers and moderator for the second conversation. To our speaker and moderator, please stay on the stage because we will give token appreciation. And we invite Dr. Bidan Rukmaini SST MCOP to give in token appreciation to our speaker and moderator.
Thank you to the moderator and the speakers for the very useful discussion today. Hopefully, what our speakers have conveyed today can add insight and knowledge for all of us.
Okay, all right, everyone. So this is time for some fun with a little door prize hunt. So we have hidden special clues right here into the room, and you might be just be sitting the next one.
Look to your left and right, somewhere next to your seat. There might just be little origami waiting to make you a winner. If you spot one, that's the lucky clue for our door prize.
So everyone, go ahead, take a quick peek around, and if you find an origami, come on up and claim your prize. Bahasa Indonesia.
Para peserta, kami sudah menyiapkan sebuah door prize dengan clue yang tersembunyi. Silakan periksa di sekitar bangku Anda, apakah terdapat origami berwarna neon dan pink dengan tulisan door prize. Apabila salah satu di antara kalian mendapatkan clue tersebut, dipersilahkan untuk maju ke depan.
Let's go hunting. Good luck. So there is ada 4 origami. Jadi akan terdapat 4 origami untuk door prize-nya. Untuk teman-teman yang sudah mendapatkan origami tersebut, boleh maju ke depan.
Ada 4 origami, 2 berwarna neon dan 2 berwarna pink. Bagi yang sudah mendapatkan, silakan maju ke depan.
Kita mencari 3 origami lagi. Ada di meja dan di kursi. Mungkin teman-teman boleh lihat sekitarnya. Oke, karena tadi kita sudah sedikit refreshing untuk mendapatkan door prize. So, ladies and gentlemen, we will take 1 hour break before the upcoming oral presentation. This is a great time to refresh, network with a fellow participant, and prepare for the session ahead. So please make your way to the breakout room when the sessions resume at 2.
Para hadirin, acara selanjutnya yaitu break time selama 60 menit. Para peserta dapat mengunjungi booth dari sponsor yang berada di sekitar auditorium dan dapatkan barang yang menarik. Untuk pembagian ruang oral presentation, ruang 1 akan berada di auditorium. Untuk ruang 2, 3, dan 4 ada di lantai dasar kelas cyber. Silakan para peserta conference untuk memilih. Izin maaf sebelumnya, untuk ruang 2, 3, dan 4 ada di ruang cyber 05, 06, dan 07. Silakan para peserta conference untuk memilih ruangan. Apabila ruang kelas cyber sudah penuh, peserta bisa tetap berada di auditorium. Untuk peserta yang berada di Zoom, silakan memilih breakout room sesuai pilihan.
Untuk para peserta, dipersilahkan untuk mengambil makan siang di meja registrasi dan kembali pada pukul 2 untuk mengikuti oral presentation. Terima kasih. Izin teman-teman, oral presentation akan tetap dilaksanakan pada pukul 13.30. Jadi teman-teman diharapkan untuk kembali